Okay, well, good morning, everyone, and welcome to CUGH 2022 and to our satellite session on global health education innovations from South Asia. We are going to get going as participants join. So what we'd like to do is just briefly overview the panel, talk about some of the session objectives and what we're going to be talking about for the next little while, and then introduce all of our panelists in turn. So just to make sure we preserve bandwidth, we're going to keep ourselves generally off of video, except for just a couple of minutes when we're introducing ourselves. So let me do that now and stop sharing so I can see folks here. Okay, well, good morning, everyone. My name is Omar Khan, and my day job is to serve as President and CEO of the Delaware Health Sciences Alliance, which includes several members of CUGH as well, including the University of Delaware, Thomas Jefferson University, Christiana Care Health Systems, Nemours Children's Hospital, the Delaware Academy of Medicine, Bay Health, and the Philadelphia College of Osteopathic Medicine. I'm so pleased that we are hosting this exciting session today, and myself as a physician and as a public health professional, although I get relatively little time away from the desks and meetings to do that these days, but nevertheless, it's really exciting to have been part of CUGH and these panels for ever since really CUGH's inception. So, and thank you all for making the time for coming, especially those of you who are logging in from outside North America with the time differences and everything else. Really appreciate your participation. So I'm going to stop the video and do the share screen now so we can have a little overview of the session. So our session today, as I mentioned, is Global Health Education Innovations from South Asia. And this is how you registered and how you got here. Several photos here from our colleagues and from the main session organizers. I want to thank the primary session organizer partner here, BRAC University, and the James P. Grant School of Public Health, with special thanks to their dean, Sabina Faiz Rashid, who is a colleague and a good friend, and also a CUGH board member. I believe she is actually the first South Asian woman board member of CUGH, and it's wonderful to again see the increasing inclusiveness of CUGH as a global health organization. We are absolutely committed to including as many voices from as many regions and fields as possible. So for those of you and your institutions who are not yet part of CUGH, or maybe this is your first meeting, we hope that you will consider continuing to stay active and becoming active in the future. And hopefully, I'm told that next year we will be in person and we will be in DC, and that's the plan so far. We're sticking to it, so we will see how that goes. I want to extend a special thank you to CUGH, and especially to all the folks who help us organize this behind the scenes, including Doris Standback, who's here right now, my friend Keith Martin, who's the executive director of CUGH. He has been a wonderful cheerleader for all of our work across South Asia, and in general being incredibly inclusive of our colleagues from across the globe. So again, I want to thank Dr. Martin, Keith, for all his support. So today's session, if you can see the outline there, we're going to talk a little bit. We're going to talk a little bit about innovations in public health curriculum, and that'll be presented by Salima Sarah Kabir. And I will request Salima to please introduce herself briefly.
Hi, thank you so much, Omar. My name is Salima Sarah Kabir. I'm an assistant research coordinator at the BRAC James P. Grant School of Public Health. So the school is a public health school based in Bangladesh, where we provide both a Masters of Public Health program as well as we do a lot of research of our own. I'm primarily involved in the research, but as part of our as part of our, even as researchers, we have to be involved in the teaching in some capacity. So I have been involved in the education components as well. I work primarily with gender SRHR. I'm working currently on a project funded by Gates with quite a few universities across the globe on the gendered impacts of COVID-19. Thank you so much for giving us this opportunity to share some of the exciting work that we've been doing in global health education.
Salima, thank you so much. Really appreciate all of your work here and contributions. Our next presenter after Salima will be Dr. Syed Muhammad Nazimuddin, who will be talking about innovating health learning methodologies for professional skill outcomes. Dr. Nazim, if you'd like to introduce yourself.
Hello, everyone. Good morning. Good evening. I'm Najim, and I'm the Associate Professor of Environmental Science and also heading the Science and Math faculty at the Asian University for Women. At the same time, I'm also visiting research associate at the University of Victoria in Canada, and founding director of Center for Climate Change and Environmental Health. So I've been doing lots of research and teaching in the field of environmental health since 2007, almost 17 years in this field. And I'm also the WASH specialist, and I teach a lot of courses within the environmental science, but at the same time, I'm also supporting a public health program at AUW. Thank you so much.
Thank you so much, Dr. Nazim, for that introduction. And we will hear next after that from Dr. Ayaz Rabbani, who is going to speak about developing faculty capacities to facilitate professional skills development. Dr. Rabbani.
Thank you, Dr. Omar Khan. Hello, everybody. My name is Rabbani. I'm from Independent University, Bangladesh. I'm currently the head of the Department of Environmental Science and Management. Our department works on various fields of environmental science, including, as you can imagine, the health effects of environmental pollutants and, of course, climate change. So I'm very excited to talk about the project that I was involved in with my folks at BRAC and AUW and others on developing faculty capacities, which has really had a huge impact in our department, especially on the faculty that were involved in the project. So very excited to be here, and thank you very much for inviting me.
Very good. Thank you, Rabbani. And our final presenter will actually be part of the panel that we'll do at the end on public health learning innovation labs, building faculty learning ecosystems, and that will be Mikhail Islam. Mikhail.
Hi. Good morning, everyone. I'm Mikhail Islam. I'm a learning designer with Learning Design Studios. I've been working with the BRAC School of Public Health over the last 7 years to redesign their MPH into a developing world MPH. And I've been working with our other partners, Asian University for Women and Independent University, Bangladesh, for the last 3 years on developing more indigenous health skills-based curriculum, as well as faculty development, more competency-based faculty development. And just thinking about how we need to work together on MPH programs, as well as our other trainings that are more contextualized and more relevant for our specific public health context. And just wanted to clarify, Omar, that I'll actually be a part of all of the panels, not just the last one.
Yes, very true.
So
thank you, Mikhail.
Look forward to
Absolutely.
this discussion. Thank you. Thanks.
Thank you so much. Thank you so much, Mikhail, for that as well. So that's a good reminder in terms of how we're going to structure this, which will basically be each presenter will present some of their content first, and then we'll actually constitute the panel, which is all of these colleagues, as Mikhail just mentioned. And then we'll have a discussion, throw around some questions, and invite audience participation as well. And then we'll go to the next session, again, have the panel discussion and Q&A. So each one of these will offer the opportunity for interaction among the colleagues as well as the audience. So we hope you enjoy that format and hope you are looking forward to asking questions and participating. So the overview of what we're talking about, as we just mentioned, this session is going to bring together best practices from across the South Asian region. And as you all know, the COVID pandemic has offered many challenges and also some interesting opportunities. And the colleagues will share how public health education has not only continued, but has in fact perhaps thrived and maybe even brought into place new models that we might consider, not only for across the region, but across the CUGH global family. So these three colleagues identified challenges initially to their public health curricula in terms of several domains: student learning outcomes, curriculum structures, and importantly, around faculty development systems. Then they developed some indigenous skills-based public health curricula, which were appropriate to the local setting, to then improve professional employability in the health sector for their students, which really meant making sure that students were being trained for the workforce of the future. There were several drivers involved in this, including design innovation, faculty mentoring, as I mentioned, as well as measuring student outcomes. And now these partners have established the region's Public Health Learning Innovation Lab to expand within their own and across other universities so that they can continue to learn from each other and in fact share those learnings as we are doing so today. And I think this is actually the first time we are sharing these experiences in this kind of international forum. So that is a wonderful opportunity. Before we begin, I wanted to mention CUGH's contribution to global health education. As many of you know who are longtime CUGH members and colleagues, part of the genesis of the Consortium of Universities of Global Health was GHEC, the Global Health Education Consortium. And several of my colleagues and myself were involved in GHEC. My good friend, the late Tom Hall, was a leader in that group. And a lot of the work around educational products was started under GHEC. And we transitioned a lot of that work over to CUGH. Lots of colleagues and friends who you know, Jessica Ever, Tom, myself, others, we were involved in the creation of that work early on. This has been kept updated and it is available on the CUGH website. So I've put the resources page up there. If you go to www.cugh.org, you can find the educational modules. You can simply type in your search engine CUGH and educational modules, and it should bring you here as well. So you'll see some featured resources, you'll see the various COVID-19 topics, and then you can choose from any of these topics as well, ranging from epidemiology, food and nutrition, monitoring and evaluation, global child health, one of my personal favorites, my area of interest, infectious and communicable diseases, and so forth. So perhaps those of you who are faculty and students and lifelong learners would like to access these, and you're free to utilize them with attribution in your own curricula as well. And again, if you have ideas, improvements, contributions, please be in touch with the current organizers of this section, and we will be happy to potentially include your contributions. So I'm going to pause there. That's my contact information, okhan@dhsa.org, if you need to find me. And let me go back to the beginning here. And we will start off our satellite today with Salima Sarah Kabir, presenting on designing skills-based indigenous public health curriculum. So I'm going to stop sharing, and Salima, over to you. Thank you so much.
Thank you so much. Just give me a moment to set it up.
Just while Salima is setting that up, I wanted to mention that this session is being recorded for those of you in the session. And we have a chat box at the bottom of your screen for all the participants. You are welcome to type in questions in that chat box while the presenters are speaking. And at the end of each individual presentation, when we get to the audience Q&A, we'll be happy to pick up those questions. Of course, you can always ask them live in the chat box as well. Probably the least disruptive way of doing that, most engaging, is to just type them in the chat box, and then we can get to it. Thank you. Salima, back to you.
Thank you so much. As Omar succinctly described, we'll be talking about how our three institutions, me at BRAC University, the team at independent universities such as IUB, and the team at the Asian University for Women, AUW, we all sort of came together to identify specific challenges and sort of lackings within our public health curriculum, and wanted to develop ways to make it more contextualized and more student-centric in a way that was beneficial to students, not only from what they were taking away, but also so that they were able to be more employable in the future. Before we begin, I just wanted to give you a very brief overview of what our public health program is like. At BRAC JPGSPH Grant School of Public Health, we offer a public health program that is a one-year full-time program offering transformative public health learning to develop next-generation public health leaders. We are an international program, so we've had over 562 graduates from 34 countries since 2005. And what is unique about our particular program is the fact that we call it a developing world MPH, meaning that we are able to provide experiential learning. And we've had students visit over 40 rural and urban sites across 19 districts in Bangladesh in 2019, before the pandemic. And this is an intensive one-year program. So the way the modules are structured is that students finish one module and then they move on to the next, as opposed to say picking courses and having electives. We have a very strict format and course structure, curriculum structure. So the course that I'll be discussing here today is our public health anthropology course. It's the second module in our one-year program. So the students finish their first module, which is an introduction to public health, and move on to this particular module. And this module is aimed to sort of, once they've had their first basic introduction to what public health is, because we have students coming from diverse backgrounds, doctors, social sciences. We've had lots, even English majors occasionally, people who are interested in maybe changing their field. Everyone is welcome. So we try to make the curriculum structure as inclusive and as easy to digest as possible. And the idea of the public health anthropology course coming in so soon after the introduction courses, because we believe that really humanizing the communities that the students are going to be working in is a very important aspect of their MPH education. So the way in which we wanted to structure the course and the way in which the course is currently structured is that it starts and ends with the community, because we believe that the community health outcomes are very intrinsically linked to the public health learning outcomes or education outcomes that we want our students to go away with. And so we focus on really immersing the students in public health in the local context. Again, as we mentioned, we provide extensive opportunities for field work, and we really immerse our students in that learning environment in order to really understand the localized and indigenous health context and help foster better health outcomes. So we look at the community priorities just as much as we look at what we want students to take away from the module, because we believe they're very, very closely interlinked. So in designing this module, the first thing we really looked at is ensuring that the students take away the important skills. So this course was designed, we call it a competency-based learning education model, right? So we wanted to ensure that students are not just going away with content, they're going away with skills. And so we really wanted students to develop specific skills that are unique to the course itself, but also ones that will help them in the future for their professional development. So we really looked at what a public health professional, in our opinion, looks like, what the public health sector is demanding, what the health organizational skills are demanding, and where our graduates have been lacking before, and how we can really ensure that these demands and needs are being met. So that's how we identify the skills that we want them to take away. for example, the example given here is basically that even in our work, because I work more with research, you can be a very good researcher, but your research project will not work unless you have the necessary time management skills, or the necessary communication skills, or even like an empathy skill to really empathize with the context that you're working with. And so we really wanted to ensure that there was a healthy balance of all the technical skills that they require, but also some management skills and soft skills. So if we look at the mapping of these three sort of broad competencies, as we call them, the technical skills and management skills and the soft skills, we've coined these particular terms to fit our particular course. Again, as I was saying, these reforms came out of a collaborative project that was undertaken by us, by IUB and AUW. And so the skills here aren't something that we all collectively agreed with, but we wanted to really make sure they were contextualized in our specific course needs. So for example, even the skills that we've identified for this particular course will not match the ones that we did in the consecutive years. So we've also revamped our Introduction to Public Health course. We've also revamped our Gender and Sexual and Reproductive Health and Rights course. And the skills identified are unique to each course. There is obviously some overlap. The soft skills and management skills may remain largely the same, but the technical skills we really wanted to ensure are ones that are unique to each course. So for example, for anthropology, we felt that gender was an important aspect, health conceptual skill, community-centric design was a very important aspect that we wanted the students to come out of the public health anthropology course taking away, and the public health needs assessment skill. These are all skill names that we've sort of come up with. So they may not be standard skill names, but these are the ones that we felt best, these are terms that we felt best reflected what we wanted our students to come away with. And the primary focus of this reform was to make our teaching more student-centric. The biggest complaint that we've received from our students, and even in our own experiences when we've audited other courses or we've observed discussions with peers, one of the biggest complaints we've had is the teaching is very didactic. It's very lecture-based, that the faculty are not interacting with the students enough. They'll be reading off of slides. They're not even, they'll be literally reading off of slides. And so we wanted to really flip that design on its head, make sure that students are at the center and at the forefront of everything that we're delivering. So we wanted to make sure that students come away really doing the learning on their own. So this is interactive, this is problem-based. We give them their own exercises. We reduced what we learned. Teacher talking time, made sure that it's at least 50-50, if not the teacher talking time being reduced less than half of the session, in order to ensure that the students are able to understand and easily grasp what we're teaching. Another thing that we really focused on when making the student-centric is content. We figured out how to organize our content better so it would be more easily digestible for students. This was particularly a challenge for the public health anthropology course because it's very easy for us, especially any of us who have studied anthropology, to get sort of caught up in the jargon of things and think about all the anthropological theory we want to teach students. But then we had to sort of unpack and think about, well, what are the anthropological theories and what are the anthropological concepts that public health professionals need? We really need to sit and unpack that in order to ensure that we were not just teaching theory for theory's sake, giving them the essential knowledge. Everything else could be additional readings, things that they can pick up on their free time, but what are the things that are core and essential for them to take away? And so we ensured that the way in which we organized our content is very simple. Again, as I mentioned, we have students coming in from diverse backgrounds. So if you're not well versed in social sciences, making sure that the way in which an anthropological concept is presented is very simple, very easy to understand. It's not too jargony, it's not too technical, so that the content is easy and that there's a narrative flow in the way in which the content is organized. So what we teach in day one will directly flow into what we teach in the second day, and so on and so forth. So that there's a very easy narrative arc that is simple enough for anyone to follow. If you're looking at our syllabus, it'll make sense why one course is sort of structured after the next. The other core principle that we wanted to focus on is, you can't see the title here, but it says it's community-based learning. It's ensuring that the community is at the center of what we are doing. And so for our course, it's an 8-day module. Like I mentioned, it's very intensive. So students do one module and then the next. So they do 8 days of just the anthropology course. And of these, 3 days are fieldwork. And so the way it's structured is students will do a few days, we'll do maybe 1 or 2 days maximum of in-class learning, and then we'll send them to the field so that they can put into practice whatever they've been learning. I think what I want to bring in here is we wanted to ensure that we held on to this principle in some way as we move to online teaching. And the way in which we did that was unique and interesting. Because we're a research institution, we have a lot of transcripts, coded transcripts that from our fieldwork. And so what we did is we presented students with transcripts as well as literature in order to help give them as close to a simulation of the fieldwork experience. So we had videos, we had these transcripts in order to really immerse students in and sort of simulated fieldwork experience, even when we shifted online. And by really sending students to the field, we found that the experience has just been, the learning is so transformative. Students come back and they see, or when reading transcripts, they're able to hear in the voices of the community the challenges, the very basic public health challenges that are faced within. So for the public health anthropology course, we send them to urban slums across Dhaka city. So the transcripts that we give them are also based on research conducted around urban slums in Dhaka city. And so they're able to really hear the very basic public health challenges, the fact that there's limited access to water, the fact that maybe there's problems with housing, fears around accessing a healthcare facility. What these challenges are, they're really able to sort of conceptualize them a lot better when it comes from the community, as opposed to us just saying, oh, this is a challenge, they don't have access to water, saying it, us as faculty or facilitators saying this, and the experience that they get when they're in the field, really seeing the house. Maybe they don't even need to hear it from a community member's mouth. They can see there's a limited access to water, that there's only one bathroom for about 10, 15 households to share. They know, they can see this in person, and so they come away with it, and it really has a really strong impact in the way in which they conceptualize health going forward. And it helps them really understand the community's real needs and priorities, as opposed to the more lofty ones that maybe we come up with as, say, armchair public health professionals. And so the way in which the course is structured, the way in which we incorporate fieldwork, incorporate their learning, is we have solution projects. So we've designed a solution project that's a 6-step framework. It's a simulation activity in which students are required to, through their fieldwork or through reading these transcripts, required to identify a community's needs, first a health ideal, and then identify what that community's health needs are, and through that identify a very specific health problem that they're facing. So the challenge for the public health anthropology course is that they're supposed to look at child's health, and we give them specific themes around child's health. So one of the themes is maternal health. The reason I'm using this as an example is because in the next slides, I'll show you a solution that the students have come up with. So we send them to the field and we tell them, okay, so your thematic area is maternal health. How is maternal health impacting child health? Why don't you think about it? and why don't you go into the field and really look into what challenges are being faced, what are barriers. And they go into the field and they're thinking about, they're asking these questions, they're asking community members, interviewing them, coming back, thinking about these things, and then they look at existing services, what are gaps in the existing services, and then coming back again. And finally, within after the third round of field visits, they're supposed to come up with a very simple and feasible solution that helps address this problem in some way. And it's a very basic simulation, but it's been so interesting to see the solutions that students come up with. And I want to share a very innovative solution that came out of our 2020 cohort. This was the last batch who was able to go into the field before COVID hit, because this course we just completed the course in February. So this was their last field visit for this cohort right before COVID hit. And so the team identified this very important health problem, which is when they went into the field and they were looking at maternal health, they found out that mothers are not seeking ANC visits, and that's because they would like their partners to accompany them. But because their partners are unable to accompany them, or they're not actively engaged, the mothers are also hesitant to seek out ANC care, and so their ANC visits are pretty limited. And when they went into the field, they started asking around, they started looking into what these barriers were. They spoke to some of the fathers, and they found out that the way in which the doctor's room for the maternal health clinic that they were visiting was laid out, the examination area for the mother was out in the open. So as soon as you entered the room, so this is the primary door, as soon as you entered the room, you could see the mother laying on the bed. And so other pregnant women felt uncomfortable because it was quite easy to sort of peer into that room and there was no privacy. So what they recommended was just a simple restructuring of the doctor's room and putting up a small curtain right here, so that once you enter the room, you aren't able to see the mother immediately if she's being examined. But the father is able to sort of sit here and talk to the doctors and have their consultations. And just a simple solution, they believed. They went back. So one of the final components of this project is they go back and they ask, well, if we propose this solution, do you think it might be feasible? They're asked to validate them. And so they got a very positive response. Father said that, yes, if the room was restructured, I have no problems. I would love to accompany my wife. In fact, they found that the husbands were seemingly interested in accompanying their partners. So this was a very simple solution that the students came up with that I don't think, I mean, we were quite surprised and taken aback when we structured the course, because we weren't conceptualizing that it could possibly be that simple, but it could be. This was then shared with the community health clinic. Again, unfortunately, COVID hit, so we weren't able to do a lot of follow-up in terms of, I mean, the health clinics themselves had to really scale down their budgets for SRHR care, other problems for another day. But we felt that this was very simple and interesting, and the fact that students were able to conceptualize something like this through this very basic exercise was something that we felt was a success. And that's it. That's where I kind of want to leave this, because our other two colleagues will go into greater detail about other interesting methodologies that are employed, how this was useful in upskilling faculty. But for now, that's my presentation. Thank you so much.
Wonderful. Thank you. Thank you so much, Salima, for that terrific overview of all the amazing work that that the team is doing, and of educational innovations across public health curricula. What we'd like to do now is convene the rest of our team here as well, and maybe open it up first to some questions from our panel and some thoughts. So Dr. Nazim, Dr. Rabbani, Mikhail, If you want to unmute, we'll see how that goes. We'll try to have a little conversation around this. So first, let me just comment on a couple of things which really struck me. One was the experiential aspect of this. Ever since the founding of the James P. Grant School of Public Health, I've always felt one of the major strengths of undertaking public health education in a developing setting, if you're going to specialize in global health or international health, is that the experience is right there. So the access to community-based healthcare, to clinical material, to the folks who are affected most by the interventions we're planning on designing in partnership with them, I think has always been a historic strength whenever we have education based in the settings they purport to serve. Now, as a proud graduate of the Johns Hopkins School of Public Health, I think we have plenty of issues in the US as well to solve, such as in East Baltimore, where Hopkins is based. But my interest and specialty was in global health. So I wound up traveling, a couple of decades ago now, to Bangladesh, to ICCCAD, and to BRAC for that fieldwork. Your students have an amazing benefit. They have to walk out the front door for that fieldwork, those who are on site. And I know several of them are from other countries as well. So I just wanted to offer that comment. And would somebody care to just comment on that? Is that benefit continuing? Do students comment on that in terms of access to experiences and fieldwork right at the point of care, rather than being in the UK, Sweden, the US, and studying global health from afar? So Salima, I'll open it up to you first, and then anybody can certainly comment.
I think that is truly our unique selling point. I think that's what draws so many international students to come to our school, is because we really, really sort of capitalize on the connection that we have with BRAC, the NGO. So we have very easy access to maternal health clinics, other field visits. Again, like I said, we have about 40 different field sites that students are able to visit. So they get a very diverse experience. They're allowed to travel. We take them across from the absolute north in Rajshahi to the absolute south to Khulna. They're taken all across Bangladesh to really see the very specific contextualized health problems that people in Bangladesh are currently facing. And our partnership with BRAC allows us access to really remote regions, hard to reach areas. We do work, the school itself does work with the Rohingya camps in Cox's Bazar. So that's also a space that we can leverage if necessary to really take students to see the health challenges faced by refugees. And we have research projects that are ongoing that allow, so when the students do their final thesis projects, we call it their summative learning project, they're partnered up with different scholars and researchers across the school, and they can choose to work in areas that the school is already working in, or they can pick their own topics. And so that really allows them to leverage that learning experience. I hope that answers your question to an extent.
Absolutely, and more just a comment. Would anyone else like to comment on that, of basing public health education in the site of experience? Nazim, please go ahead.
I'm just curious to know the feelings of those students when they visit community. So can you share some of their expression or feelings when they visit and after the experiencing community-based field trips?
So Salima, I think we'll give that to you as well in terms of how students feel in terms of accessing their community experiences. And maybe, Salima, if you can step back a little bit and tell us about the students themselves, maybe what demographic characteristics might they have in terms of ages, for example. And I think it's just as an example from my own experience, when I was in college, and at that time, I had essentially my first really community-based experience when I was teaching in an underprivileged high school in West Philadelphia, where I went to college. That was a very different experience from when several years later, after medical training and so forth, when I was doing similar experiences. Maybe a little more understanding, but also maybe a greater depth because of academic training as well. So it kind of depends what the background of the students is. So would you like to comment on what your students are feeling when they go out into the field?
So to answer your second question first, our student demographic is quite diverse, as you might imagine, because it's a professional public health degree. So a lot of people who are just looking to change fields often come in. We get a lot of doctors from across the globe, and we get, I would say, about 50% are recent undergraduates who join soon after completing their degree, and the other are slightly older students who maybe have gathered 2 to even more years of experience before they come join, and are looking to sort of, maybe they're working in specific development fields and they're looking to sort of shift to a public health career, and so that's when you'll come in, students will come in. So it's a little hard to sort of pinpoint the demographics. My other colleagues would be better equipped to answer this question, those who work more closely with the MPH program, but it's a very diverse cohort. And the experiences, again, I don't want to speak for our students, but I believe that from what I've heard from them, they're, when we accompany them, it's such a mixed experience, because it's even those who are living in Bangladesh, I know, because when we shifted to online and we asked our students, how many of you have actually been to a slum? About 3 people or 4 people raised their hands. So even though we're living in Bangladesh and you can see a slum next door, you're probably not visiting that slum. You're probably not really setting foot. And so it's eye-opening for everyone. It can be challenging because it's such a different experience that we have to really prepare our students when going in to make sure that they're culturally appropriate, that they're not being too invasive, they're being reflective and really taking into consideration that they're not, like making untoward comments. But overall, I think the students come away from it more reflective. They're more understanding of like what the challenges our compatriots are facing.
That makes a lot of sense, and certainly that bimodal curve, as you mentioned, of the graduate degree students, that's typical, I think, of worldwide what we see as well. Would our colleagues, either from IUB or AUW, Dr. Rabbani, Dr. Nazim, would you like to share any of your experiences from your institutions, kind of in the context of what Salima described from the BRAC School of Public Health? Does this mirror your experience as well?
Absolutely. At IUB, at the Department of Environmental Science, we put a lot of emphasis on going onto the field, and we have a saying that environment is not inside the classroom. There is an environment in the classroom, yes, we understand that, but all of that we are studying is outside the classroom, and so we take frequent field trips, and it's sometimes very interesting to see how the students react to being in the field, because people go out into the villages, and some people actually come from the villages, but they do not look at their experience is different, because the lens that they see their villages and the places they go to are different. So when you go through an academic trip, then we kind of train them to look at things in a different way. And it's eye-opening for many of them. I've had many students who come from the villages, but then they learn something at the university, and then they go back to their villages and they see things in a different light. And just to make them open to that possibility or that experience is, I think, a wonderful thing when you see that happening in the students. So yeah, as Dr. Omar Khan, you mentioned that one of the, maybe unfortunately, one of the advantages we have in Bangladesh is, if you want to look at any problem related to public health or the environment, you just have to walk out and you're there, right there. So, so making that part of the teaching experience is a unique characteristic of what we have here in Bangladesh, and also something that we should utilize more.
Thank you, Rabbani. That makes a lot of sense. And I think what you said right there, I want to pick up on a couple of points. Yes, I think for one thing, Bangladesh has, for better or worse, been a tremendous public health lab in so many ways, but also a place for improvement, process improvement, and interventions, which I think is what distinguishes that setting from other places around the world. Other places have problems, but I think a lot of the solutions have also come out of the setting there. And I think just for the audience, if they're not familiar, whether we're talking about the development of ORT or really microcredit being pioneered by Grameen and by BRAC, the cholera vaccine trials, and so many other innovations have come out of the area as well. So I agree with you. It's a wonderful opportunity to learn and to serve at the same time. Rabani, would you comment on the urban population? I know that at one time IUB was participating in the urban rural study as well, the PURE study, I think. I'm not sure if that's still going on, but it matched urban cohorts and with rural cohorts as well to study their health outcomes in a longitudinal fashion, if I'm not mistaken. Are you noticing any difference between students who are coming from the urban cohort in Dhaka city, for example, versus those who are from rural areas in Bangladesh or South Asia, versus those who are just international students who might come from the US or the UK to study public health?
Yes, that's a very interesting point you made there. Yes, we were part of the PURE project. They were looking at two cohorts, a cohort in the urban area and a cohort in the rural area, and looking at a whole bunch of things, including health differences, lifestyle, and it's basically monitoring the two cohorts over a long period of time, 20, 30 years. And when it comes to students coming from an urban area and a rural area, there is a huge difference. Actually, our university is in Dhaka, which is the capital of the country, and is a very urban. It's in the middle of the urban area, and the students that come to IUB are mostly from Dhaka. I would say around 70%. But we have a sizable number of students who come from outside Dhaka as well, from the rural areas. They come into the university. They rent houses where they stay. It's an experience like you would get if you go to an American university as an international student and you stay in a dorm. It's kind of like that experience for rural students that come to Dhaka. But what I always am amazed at is, I hate to say this, but how insulated urban students are. There is especially in Dhaka, the students who are coming from Dhaka, their knowledge of what is happening outside Dhaka is in some sense very limited. And having a curriculum like Salima mentioned or described, where you make being part of the community an integral part of the curriculum. And I think that is very, very important. Whether you're an international student, an urban student, or as I mentioned, even a rural student. I've had people who are from a community going back to that community through our courses, going back to the community, and then looking at their own communities in a different light. So all of that helps, but the urban students that we get are very much insulated from what is happening in the rural Bangladesh, the real Bangladesh as it were, and the problems that they face and the solutions that can happen. It's, I think, an unfortunate circumstance that the urban students are very much insulated, but that's what it is. And as a facilitator or a teacher, as it were, as a university professor, my job is to open up the eyes and ears of the students that are under my care as much as I can. And a part of it is getting them to be more aware of what is happening around them.
Thank you, Rabani. That makes a lot of sense, and thank you for that very nuanced explanation. In North America, for example, as you well know, we have had a different kind of experience, but similar in terms of the clustering. The students here typically who may be from inner city urban areas and who may be from the rural areas, they have a different perspective, kind of matching but different perspectives, versus those who may be the suburban students. They're the ones who you may describe more from Dhaka city. They're the ones who may have grown up with a certain background and perhaps even affluence, and those who are studying things and seeing these conditions for the first time. but our job as educators is, again, to design curricula that open the eyes and educate all of the students, all of us together. Michaela, wanted to bring you into this in terms of any comments you might have about any common themes that you see about the innovations in public health curricula across the institutions. You're an expert in instructional design. Would you have any high-level thoughts on how one has had to adapt instructional design to meet these innovations in public health curricula for so many different kinds of student needs?
Yeah, I mean, I think when we undertook this process of redesigning our MPH and then working with our two partners, our vision was really coming from an urgency to reconcile what students were studying in their curriculum with what was happening in communities regarding their own health priorities, and the lived experience of their lives. And so in trying to understand what would be actually more authentic or genuine to promoting, community health outcomes. I mean, that's the goal of, I think we can all say that's our mandate as schools of public health. How do we go about doing research, developing solutions, services, et cetera, that really can foster higher, improved health outcomes for communities, and of course, hopefully prioritizing the most disadvantaged communities, where of course COVID has kind of exposed that we've in fact excluded most of the disadvantaged communities in our health work. So I think that was where our starting point was, and so this was important in terms of the big picture of our thinking about curriculum. How do we make sure that our curriculum is really linked to those communities' health? And so the first thing is, well, obviously we need to develop skills that can actually have some kind of bearing or impact on improving community health. That was missing. As you know, most of our curriculum is in one way or another adopted almost, wholesale from either an American curriculum or a European curriculum. And of course, that's just incompatible with what LMIC, developing countries, South Asian health contexts reflect. So we needed to do a lot of deep thinking around, well, what would actually reflect, what curriculum would reflect this reality on the ground here. And so with that as our starting point, and also kind of moving away from the conventional, MPH, which for us was extremely research-based. And while research is mission critical to health, it can't be the end of health. Research has to be a means towards health outcomes. And so we needed to integrate the actual program and service delivery. And how do you get services to health and improve community well-being? And so when we made that connection, that's kind of how we designed our curriculum. So that's kind of how we also approached our partners in this. Sorry,
we did get that.
Did I lose you? You froze up a bit.
Okay, there you go. We could see you. I think we lost a little bit of bandwidth, perhaps from your end, but I think we're okay now. I think the trick of keeping the video off when not speaking is probably going to have to be the best one here. So we have some audience questions as well waiting in the wings. So let me go to a couple of them here. And first one is actually from Tim Gibbs. Hi, Tim. Tim is the executive director of the Delaware Academy of Medicine and Delaware Public Health Association here in the United States. And I introduced the Academy at the outset as being one of the members of the Delaware Health Sciences Alliance, several of whose members are also CUGH members. Tim, over to you, please. Tim, you're muted.
There we go. Technology. Thank you very much, and good morning, everyone. This has been a fascinating presentation, and actually the last gentleman speaking touched on my question, which is, given the geographic location, the general locale in which your education is occurring, how well prepared do you feel your students are to practice public health in other locales, in particular northern locations? My family's from Canada, so Newfoundland, Canada has some very significant and obvious differences from Bangladesh. That said, public health models and principles should be transportable. I reflect that when I did my own master's public health capstone, I was a US-based education, did the capstone on the island of Bermuda. I will tell you that my US-based education did not prepare me for the nuanced cultural differences that existed, in a different country. So just a general response to that. I think the work that you all are doing is just fantastic. Thank you very much.
Tim, thank you so much. So a great question in terms of how adaptable and generalizable is content based on both the approach that you all teach students as well as the content. So, I might go back, Mikhail, to you just for some broad overview thoughts, and then we can go to our other colleagues in turn. So would you like to start off with some thoughts on that?
Sure. I think I'm not sure how transferable it would be, because our MPH is actually designed, it's geared for specifically LMIC public health, developing country public health, South Asian public health. So I think, and because there is such a vast, range of health environments and contexts, and especially if we talk about developing world, quote unquote, developing world health context, it's so diverse and so divergent from, say, what you're describing in Canada, that it probably wouldn't have a very explicit relevance to your particular health environment. It's really geared for, African countries, South American countries, and Asian countries who are now going through that in the LMIC developing country kind of growth trajectory, high growth, high population trajectory. So I'd say in that way, it probably wouldn't be directly relevant. However, I think there are certain universal principles that we do facilitate in terms of skills, which I do feel are transferable with some probably, time where you'd need to settle into a different environment. So I think that would be quite transferable. Health empathy skills are universal. Community-centric community-centric design skills are pretty transferable. However, if you get into this, our curriculum, which is very, very much geared around, developing country health, and we use Bangladesh, in fact, as an active learning methodology to understand developing country health challenges, needs, and priorities. In that sense, I would say it probably wouldn't be directly transferable. But I would add that I think it would be, if you do talk, which Dr. Omar referred to, if you go into low-income communities, if you go into ethnic minority communities where there are very severe challenges with health, in fact, the data shows that there are very, very similar parallel challenges to health access, health quality, and just overall well-being challenges. So I think a lot of that would be relevant. I hope that answers some of your question.
Yeah, that's a very salient point. Thank you.
Mikhail, thank you. I'd like to offer the opportunity if anyone from for IUB or BRAC or AUW would like to chime in on that question in terms of generalizability of degree programs and students. Please feel free to jump in.
Yes, I'd like to jump in a little bit. I agree.
Rabani, go ahead.
Yeah, I agree with everything Mikhail said, but two things I would like to emphasize. One is Mikhail touched on empathy and the skills that you get, the empathy skills that you get from the courses that we designed or the courses that are done in Bangladesh. That I think is transferable everywhere, and also especially in the public health field. And also the fact that you are addressing a problem in a very different way. You're looking at a problem where maybe from a more holistic kind of approach rather than a reductionist kind of approach. You're going to the place where the problem is, and then identifying the problem, trying to come up with solutions in a more inclusive kind of way. All of that helps whatever kind of public health problems that you come across. And I think that skill that you develop as a student that cuts across any kind of situation that you find yourself in. So yes, I agree with Mikhail that there's some, obviously we're trying to teach students which are relevant to the communities that they're in, but that all our universities are placed at, but there are skills that they will pick up that they can use in whatever public health situation they find themselves in. At least that's what I think.
Thank you, Rabbani. Anyone else wish to chime in on that?
I can try a little bit. So yeah, when this transferable, but still I'm thinking about different indigenous or ethnic minority, like already talked by Mikhail, like First Nations in Canada, for example, or other ethnic minority indigenous community, there are similarities with low and middle income countries context or health. Because when I'm working in the environmental health sector, wash sector, like water supply, sanitation, there are many similarities found, and that can be also transferable in terms of knowledge. But I also agree with Rabbani regarding the transferable skills, like whatever skills we are actually getting from through this degree. I think those skills are actually transferable directly to any kind of locations. Thank you.
Very good. Thank you, Nazim. That's all very good points. And I think the key points here being made are that there are absolutely a core set that might be very relevant to that particular community. No one community looks like the other. You can be in the United States, for example, or North America, such diversity of settings, rural, urban, suburban, and really no two urban areas are exactly the same either. And then there's some generalizable skills. Several of you may be familiar with the book Community-Based Primary Healthcare, which I read many, many years ago. And its actually titled is From Bangladesh to Boston, and is written by John Rohde, and talked about lots of examples from my own experience. And I think, Nazim, you brought up an excellent point about First Nations and indigenous people. Several years ago, maybe about 15 years ago, I was sitting with my good friend Tim Brooks, with whom I've written a few books on infectious diseases and tropical medicine. Tim is a commentator for National Public Radio. He is an author, and we used to play cricket together. And Tim and I were in Bangladesh to do some work with IUB and BRAC and ICCCAD. We're actually doing a writing workshop. And Tim reflected on indigenous people in Bangladesh. And he asked questions which I could not answer, even though I have extended family in Bangladesh. I'm not Bangladeshi myself. So he asked questions about the indigenous people, such as the Chakma and the Moro, and what their languages and their cultures were like. And we invited some colleagues of mine from the community to have dinner with us and chat with us. That experience gave rise to a project which is now online. It's called Endangered Alphabets, where Tim Brooks actually carves the letters from endangered scripts around the world to give them visibility and to help their development. And we found great similarities between Native American cultures in the United States and First Nation cultures in Canada in the process of doing that. There are certain shared themes in minority communities as well. And from my own experience as a physician, whether it's learning how to treat diarrheal disease in Bangladesh, or applying those skills just 2 weeks ago, mixing up a batch of ORS here using the exact same recipe that I was taught way back when in Bangladesh. Those are some transferable skills. And I think the principles of community respect and engagement, this is a place where we in North America have a lot to learn. So community engagement in research is something that I think you all are modeling so well, and we'd love to learn from that. We have an annual community engaged research conference here that is funded by the NIH, and we talk about exactly this concept, how best to engage communities. So I know we'll keep talking about this theme in other presentations as well, but I just want to thank the presenters for such nuanced and important responses to these questions. Before we close out this session, I just wanted to turn it over to the audience for any other things that they would like to add. You can please type them in the chat box, or you can raise your hand in the reactions at the bottom of the screen. You can do raise hand, or you can go to the chat box. We'll give you a couple seconds to do that. Otherwise, we will then transition to our next session, our next presentation. Let me make sure we have everyone checked in here. Very good. All right. Very good. So for questions, etc., keep in mind lots of opportunity throughout the satellite session to do that. So we will go next to our colleague Nazim, who you just heard from, Dr. Syed Muhammad Nazimuddin, who is the head of the Science and Math program and Associate Professor of Environmental Sciences at the Asian University for Women. And he's going to be speaking about innovating health learning methodologies for professional skills outcomes. Nazim, over to you. Thank you so much.
Thank you, Dr. Omar. So I think as already Selima mentioned that we are part of this project, Transform PH project, and this project we have actually transformed different methods in terms of teaching and learning, particularly student-centered learning. And I was part of the last year project. Actually, last 1 year I've been involved in developing one particular course, which is environmental health. Although this is environmental science course, elective course, but this course is also offered for public health bachelor offering UW. So when I came here in 2018, I found this environmental health course only elective course for public health and environmental science. So interestingly, when I started this project and I redesigned this course through this Transform PH project, and I was actually trying to convince the to our team members to integrate this environmental health as a mandatory course, because it's such an important part. Like if we are thinking about the global health concept or regarding the already data said that 70 to 90% of the global disease are connected with the somehow with the environment, changing the environment. So that's why this is very, very important actually for global public health curriculum to integrate environmental health. So I was successful, and we revised our curriculum at UW, all curriculum including environmental science, public health, and also bioinformatics. And then successfully we have integrated this course as a mandatory and one of the main thematic course. So I will not talk detail about the course, but what I want to share this environmental health, this course actually we uncover and unpack a lot of issues and health crises related to different environmental factors. It can be air quality, water quality, waste management, food safety and scandal. This also applies for emergency environmental health, particularly when it's a conflicting area or refugee camps, and also child environmental health. So the logistics of this course, like generally we offer this course during summer, which is a little bit shorter term, 2 months with extensive hours, like 8 weeks course, 2 sessions per week, and also each session is 3 hours. So it's really hectic for students to stay, and it's also challenging for an instructor to keep continuing teaching during 3 hours time. And then I found I just try to innovate and re-innovate different kind of methodology. I will only pick only one methods which impacted greatly through this Transform project, and then we reinvented based on the skill outcome based methodology. And then we used to have field trips on site, but generally during last 2 years we offered virtual field work and field visit, developed based on different field visits in the past years. And then also virtual labs like LabStar, for example, we simulated different labs so that they can also learn from these simulations and video. Sorry. And on-site, as I mentioned, we have on-site field visit. Particularly, we visit drinking water treatment plants or refugee camps, for example, in Cox's Bazar, and so that we can combine from the reality, and then also they can learn from the real context of the field trips. So there is a small story behind developing this concept. It's called STL, group discussion. I know this is a traditionally, we have been applying this traditional group discussion, which is the one of the key concepts or key aims of this traditional group discussion is the engagement of the students, like student-centric or student engagement or interactive, or creating an interactive environment for that. But what I have developed in a different way, this three-dimensional teaching and learning approach is also part of STL. STL is small to large group discussion. In the figure, you can see this three-dimensional, this figure is here. See clearly why this is three-dimensional group discussion. As an instructor, I can learn from each of them. I'm coming on that later. And then also as a small group, they can also learn from me. I can also learn from them. And then when they come to the main session as a large group, then that's actually we try to develop this kind of three-dimensional, the three-way of learning. It's a completely a student-centric concept. So generally what we do, we always offer, like every week we have this within two, when we offer this course during the normal semester, 2 days per week. So each day, each 1 day per week, we have this kind of STL group discussion. But during this summer course, it's 3 hours, right? So each and every lecture, we have this STL at the end. Last half of the time, actually, we use this STL group discussion. So generally, at the beginning of the STL group discussion, we have a briefing session regarding different topics based on the previous lecture. And then we design or redesign different kind of questions. And those questions were asked just directly based on their local context. So they don't have to actually go through the Google and then search everything and then share with us. No. So we always encourage to share their own story based on the local context of their own country or own districts where they're living, connected with that particular lecture. Because if we are teaching waste management issues overall in general globally, so that within small group, they can share what are the issues of a particular waste management system in their own community. So they can share their own stories, what's going on there, why this is happening, what are the root causes of that waste management system, and how can we solve. So that's been like a solution-oriented STL group discussion. And then after briefing session, around 10 minutes, and then we start group discussion. It's like 40 to 50 minutes because they need sufficient enough time to interact with each other. So when they start, before that, I always instruct them to select at least one discussion leader or facilitator who will facilitate the entire small group, and then one note taker. So if everyone actually started taking notes and everyone facilitated, that's actually challenging for to manage the small groups. That's why every time it's a by rotation, one student cannot actually lead another day. So it's a by rotation. Everyone has a chance. If it's a small group, everyone has a chance to become a discussion leader and as a note taker. So after the discussion, then after 40 to 50 minutes, actually we break the room. Online, we started in a Zoom breakout room. But when we break out the room, then we return to the main session. So on site, we return to the main session, of course, and then we have 30 to 40 minutes to present. Each and every group that discussion leader will present actually in the class. So they don't have to discuss in detail, only summarized outcome on that particular topic. That each and every group they share, each and every person they share their own story. So by the way, AUW has students from around 20 countries, Asia, Middle East, and Africa. So within Asia, even within country, we have a very diverse background of students. We have garment workers, we have refugees, we have marginalized, indigenous, and within country also different multicultural backgrounds. So it's a very, very diverse background. And then they share all the story during the large discussion. Then at the end of this still good discussion, we have a rich information and different stories shared by each of the students. And then we have a question and answer session. After each of the presentation, we have question and answer session. So this Transform PH project, I found, although I have applied this in Canada as well, a small story I wanted to share with you. My postdoctoral supervisor from University of Victoria, Canada, in 2016, when we were talking about teaching, then she told me students don't talk in class. I was quite surprised and quite worried actually, and concerned. I was concerned if I start, because I also supposed to start my teaching very soon. And if students don't talk in class, how can I actually teach if they don't talk? So one way teaching or teacher-centered teaching, I don't like that. So that's the problematic. So I was thinking, okay, let's develop something before I start my teaching. And then I started this kind of concept. But during that time, then completely changed. A student started talking and they didn't stop even talking. Then I shared with my supervisor, hey, students are talking. I don't know what happened with your class. The student didn't talk. So that's actually one of the main targets, to engage students and learning. But due to this Transform project, we have got a lot of different aspects like benefits, and I've discovered and rediscovered different kind of benefits and skill-based outcomes when I applied this STL group discussion within this environmental health course last year. So the benefits we found is a completely participatory learning approach, and it's very student-centered teaching approach. And there, during this HTL group discussion, we have active interaction with teacher and student and engagement. Because generally what, during those 40 minutes, I always try to join around 5 minutes in each group or 6 minutes in each group, and then try to contribute my philosophy and try to interact so that I was part of each group members. And then that this way actually actively teacher-student engagement actually can be happen. And another most important is because students coming from different diverse background, so equity, diversity, and inclusion is very, very important. I always focus this so that everyone can start talking and they don't feel excluded within this small group. I always try to monitor that and then try to enhance this equity, diversity, and inclusion even before STL group discussion starts. And the students, they feel empowered. So they feel empowered and ownership of that knowledge because they are sharing their own particular knowledge related to their own experience and their own country, or locality, or community, or urban context. So they feel this knowledge is there, actually empowered. Although I'm teaching, but they actually feel this is my knowledge, my information I've shared with all of us. So they feel actually empowered and ownership of that knowledge. And another thing is I always try to share with the students that please connect with your heart with your brain so that you can reach to your community. You can return to your community. As Selim actually mentioned about the community engagement, how students actually supporting community through this kind of MPS program. But when we talk with the students, I always try to encourage them, please try your heart with your brain, because this degree is not only for you or for your career. You have to return to your community, and there is something you need to bring so that whenever they are learning through these kind of courses or a degree, they always connect their heart with their brain so that they can actually reach to the community and they can return and then for the benefits of their society. And most of our students actually return to their community, their country, own country. Very few of them actually stay and work in Bangladesh. So, but we found majority of them return and then they do job either even agencies or in the government, or even several of my students actually just day before yesterday, 2 of my students, they got offer from University of Oxford, and one of the students actually started the MPhil at Cambridge. So there are high outcome actually skilled, and they actually reaching to those kind of university, top universities, and also other kind of working in the NGO sector. And the student skills. So I will not talk detail, but I will just list down this the leadership skill they can, because when those discussion leaders, they start facilitating at the end of the course, they actually develop their leadership capacity and communication capacity, and how to collaborate with each other and how to facilitate this kind of teamwork. Like they say, that because they've been working as a team during the entire semester. So create concepts. So this kind of project, I also found they develop different kind of concept, because when they start their thesis after semester, then they found interesting stories from HTL group discussion. They started creating concept note and also developing their own. Okay, so and then also social capital. Bonding, the relationship really, as I mentioned, they're very diverse, coming from different background, different religious, cultural background. This is very, very important to develop the bonding and relationship. So this HTL actually facilitating and enhancing the relationship, so that social capital among the AUW community within this class actually increased. Of course, this teamwork is a very common aspect of this good discussion. And as a teacher, how can we get benefits from this kind of HTL group discussion and this kind of methodology, student-centric methods, improvement of teaching approach? I found every year, every semester, my teaching approach is improving, because whenever I got some ideas from the HTL, I always try to incorporate, and then next time I always try to share the stories for another student group. And then also different ideas, they should always share a different idea, but they always congratulate me on this HTL group discussion. And building rapport and trust, this is very important actually. From the beginning, when we explain this, building rapport with the students and trust is very, very important as an instructor. So I found this concept, this approach is really, really effective for any instructor. And then creating interest of other faculty members, like when students they start talking with other faculty members. Okay, Professor Nazim, the HTL is really, really interesting, and they've been talking with the different talks and tell space. They discuss and also interact with other faculty members. And other faculty members also express their interest to learn about this. And I always share with them about this concept and continuously improving different aspects of this HTL. Grant writing, this is another important. I found very, very interesting for an instructor when we're talking, because they're bringing their own story from the local context, like Mikhail already mentioned about this, right? So the local context, if we get local contextual information from students, there are a lot of, and then when we develop that kind of grant writing, then I generally encourage them to actually get involved in those kind of grant writing. So there are several students that have been working with me, because I'm also a founding director of the Center for Climate Change and Environmental Health. So last year, actually, I established this center, and more than 20 research assistants, voluntary research assistants, they have been working on that. And they're actually supporting me on different projects and grant writing and also publishing. And national international networks, of course, when I get a lot of idea, then I started working with the different international national collaboration with different universities, like University of West of England, University of Victoria, and other types of universities. Actually, I've been working on them. So yeah, I'm done with the specific skill-based outcomes through this particular HTL group discussion. So these are some of the photographs. I have so many photographs and interesting stories, because we applied this HTL in class, and we also apply in field and in lab. So there are three major areas actually, particularly if you're talking about science courses. This is very, very important actually to instruct, to apply this kind of participatory approach. So the students, they learn and they enjoy, then interact with each other, and then they produce a very interesting scientific outcome. And also, like when we are working in a class, they're very, very useful and they found very effective. And they always try to, in my evaluation, I always check and try to improve whether there is any instructions provided by students. So they always try to express their interest, imaging STL group discussion. I really like that kind of, so there are lots of different stories I found actually in the evaluation. And then even within field, we also have a beach cleaning, for example, last year, we also have this beach cleaning in Patenga Sea Beach in Chittagong. So we also applied this kind of STL so that they work as a team and they feel very inclusive, so that they can be recognized within a university and also externally other organization. We also have this climate rally, our university, like a different club actually, like sustainable club, we have a UW Waste Management Club, they actually organize this kind of events. And then I always try to incorporate our environmental health course and different topics through different kind of events. Then we also explore different nature and how nature is connected to the health. And then we also did this one, we visited, just yesterday, we visited one lab, Bangladesh Forest Research Institute. We visited lab and then we also applied the same concept so that they enjoy within lab, so that they don't feel bored. Yeah, so that's it. Thank you so much. I don't know whether I exceeded the time. Thank you so much.
Wonderful. Thank you. Thank you so much, Dr. Nazim, for that terrific overview of all the work that is going on at AUW, in particular in the area of environmental health. And we'll certainly open it up now to other questions and thoughts from the panel. And I want to first mention, there were, in case I neglected any questions from the previous session, I think Navneet had a couple of questions, which I answered in the chat. But just so I didn't neglect anybody, Navneet, did you have a particular question you would like to ask the team before we get on to this session's questions, if I missed any of yours? If I answered yours, then that's fine as well.
Okay, thank you, Omar. Yes, very enlightening, and thanks for tabling the session. Salima, I had a question about transcripts. You're using transcripts. Is Salima still here?
Yes.
Yes, hi, Salima. Yes, you were using transcripts as a source of, I forget what it was. I guess discussions before they embarked on their projects or during their project planning. What did you mean by that? How do you use transcripts as a source?
COVID, when we were unable to accommodate in-person field visits, one of the ways in which we sort of supplemented and simulated a field learning experience was by providing transcripts. So BRAC JPG is very lucky in that we get to do a lot of research where we're just as much, if not more, engaged in research than we are in our academic and education sector. So we have a lot of transcripts in-house that are coded and appropriately stored so that they're safe to sort of hand out to students. So what we did was we, from within our internal database of transcripts, we went through which ones would be relevant. So we had to do a pretty extensive process of really screening them, ensuring that they're relevant, they're applied to the context that the students would be studying. And then we would often just pick excerpts as opposed to full transcripts because they tend to be quite long, just to give students an experience of the kinds of conversations, the kind of dialogue that takes place in the field, since during COVID, they weren't able to visit the fields at all. Does that answer your question?
Oh, it does, I think. Thank you very much. Yes.
Very good. Thank you so much, Salima. And so just picking up some of the themes from not only that question, but also what Dr. Nazim mentioned, one thing that struck me was the importance of small group learning. and of the didactic methodology that's used to make this as interactive as possible. And I think all of us know, not just as educators, but also as learners, we learn best when we're engaged in the material, right? So whether we are in the community and we are engaging with that material in a very tangible fashion, coming back to the classroom, presenting it, it's really important to get to the minds of learners in many, many different ways. The least effective method of teaching, as you know, is lecturing. And yet so much of didactic materials is centered around lecturing. So small group learning, experiential learning, questions and answers back and forth is a cornerstone of contemporary pedagogy. So the question I would have, Dr. Nazim, maybe to start us off would be, how did COVID-19 especially affect this? Because it's so dependent on interaction. Whether small groups, of course, you can do them virtually, but most of the time we do small groups in person, and also going out into the community of the necessary restrictions, vaccinations, masking, hygiene, and so forth. Could you comment on disruptions suffered to this model, if any, through COVID, and maybe what adaptations you might have done as well? Thank you.
Thank you, Omar. Yeah, this is very important question, because we use this Zoom breakout room, but still I found challenging because they've been using this Google Sheet, and everybody actually they just divide their works, and then everybody actually just writing, and interaction not that much. But some of the groups, they actually are very interactive, and then few of the groups, they didn't have that much interactive. They're just dependent on the Google Doc and then shared. But during the main session, it was very interactive, because they know each other, and then they have their own group. Sometimes they also develop their own WhatsApp group instantly, and then they discuss there. So when I join their breakout room, they say, Professor, we are not here, we are on WhatsApp. So I go, okay, it's okay, no problem. So let them do their work. So this kind of interactive with the teacher and student during this still is quite challenging during that time. But few of the groups I found, they actually interacted very well. Although we know there's some like connectivity issues, because most of the students, they return to their home, and in a remote area, they use data. We also provided them the data funding support to use the data, but still we found a lot of challenges in terms of connectivity issues. And then another the very important is the field level. Yes, recently we visited the lab, but what I've done, because I have lots of different experience, more than 15 countries. I collected different videos and photographs, and I always try to. So what I did last year, I just tried to articulate them in a video or in a editing them, and then I shared with them so that they can feel they visited a virtual lab actually. So I just try to simulate them that they can feel, okay, this is very good. But still, you see, face-to-face instructions or the face-to-face field visit, we cannot actually say this is similar. Of course, it's completely different. So this semester, we have been actually instructing face-to-face. So this is very effective now, I found. I don't know
Very
whether
good.
I answer your question.
No, thank you, Nazim. That's very good. Let's go and turn around our panel as well and ask them to weigh in. And Mikhail, maybe I'll start with you as well. In terms of commenting from an instructional development design perspective, it's of course challenging to include interaction in a time when we have to rely more on technology. And any strategy that you have come across that can be helpful in this setting, and what you have seen across the partners in this group as well? Any comments from you?
Yeah, well, one thing is that, in fact, what we were working on then COVID helped us accelerate is, in fact, a paradigm shift from what we call instructional design to learning design. So instruction design is, again, kind of instruction-based, design of curriculum, as opposed to learning outcome-based design. And so we were working on that, and COVID kind of helped us, gave an opening for us to really test our mettle out on that. And so what we actually found was that remote learning in itself wasn't the big challenge. In fact, it was really our, I think, commitment or willingness as faculty and a team to really think more creatively about learning design and what were the real skill outcomes we wanted. So once we were clear on the skill outcomes we wanted, and we kind of followed what Amazon calls working backwards, then actually the learning experience can be to a great extent, enabled online. And you can preserve a lot of the core learning, even on an online environment. There are obviously certain things that you cannot replace online, that, sending our students to the communities, talking to the community members directly, engaging with them, immersing themselves in there, that is not really replaceable. However, as Salim had mentioned, curating this methodology, which was our solution prototyping projects, curating it around what the students were going to study in terms of the research material, the online material, the transcripts that one of your colleagues had asked about. We curated it around solutions and prototyping. And so working our learning design backwards actually enabled students to still come up with some incredible solutions to real world health problems. And so that was really our learning and kind of our testing of, if it works, it should work everywhere. It shouldn't just be, in communities. Can we replicate the skills development setting? And maybe I'll just give you one example of how that worked, which was really quite eye-opening for all of us. So for example, in this public health anthropology course, we had a group that worked on gender, looking at gender as how it impacts on a child's health. And so one of the big challenges in many countries is that, in fact, the research bears that growing up, a boy child will be actually fed better than a girl child. And the thinking is that the parents or the father think that, well, if I feed my son, then one day my son will grow up and earn money and a job, and then he'll support me. But the reality actually is, and this is what the group creatively, we facilitated them to think about, was, does that actually happen? And so what the group actually was challenged to do was think about that. And they actually realized that, wait a minute, even though this is one of the cultural assumptions that a father makes about his son, the group actually did a very creative messaging to challenge and say, well, who actually takes care of, look at your own parents, who is taking care of them? Who is taking care of them more? And of course, the father said, oh, wait, my sister is. Oh, yes, I see my neighbors. It's the daughter who's taking care of the elder parents. So that then compelled him to think about, oh, wait, so I need to take care of my daughter as much as my son, because actually my daughters are the ones who take more care of their parents. And so they developed a creative messaging around that. And it was really so well done, because it broke through such a kind of, it's an ingrained belief, but it's really not based on what's seen or on the reality. And so the fact that they could bring that in and challenge that very kind of non-confrontationally, almost humorously, but with a kind of aha moment, those are the kind of things that actually happen in communities, every day. And so the challenge, of course, as you know, is how do you communicate these gender perceptions in a way that won't, in any way kind of put people on the defensive, but will challenge them in a way that they will think more critically and realize that it's actually in their best interest to, support both their children, not just one child based on gender. So that's kind of how, even on an online setting, we could bring that out of students.
Mikhail, that's an excellent point, and thank you. And thank you, Dr. Nazim, for mentioning that as well. This is such an interesting topic, not a side topic, but such an interesting topic that you mentioned, Mikhail, about the perceptions that are challenged when we start talking about things. And certainly working in Bangladesh and India and Pakistan has taught me a lot about challenging these gender perceptions and stereotypes as well. People assume, both from the global south and the north, that there are certain perceptions that still hold true. But in fact, when you look at the data, as scientists, we look at the data, and you look at the data as to who is actually supporting families, not just in the traditional ways, some of which you mentioned, such as elder care, child care, such as the many important activities relating to domestic work and family care. but in fact, economic empowerment. I believe that the economic contribution, certainly on a per capita level, of the workforce in Bangladesh is disproportionately in favor of women now as opposed to men, as women are equal or greater contributors to the economic workforce through a variety of projects, including those that large NGOs like BRAC and others have undertaken. Microcredit has been a big part of that story. So it's important to keep re-examining our own assumptions and stereotypes as educators and as learners. And as you said, that interaction can happen in any format, certainly with its challenges there as well. Let me go to Rabbani, Dr. Ayaz Rabbani. I think you were going to offer a comment on that as well.
Yes, thank you. I just wanted to talk about, I apologize, my video keeps coming in and out. But on the challenges of doing online teaching, I just wanted to point out that, yes, we all hated doing the online teaching thing. And to a certain extent, we're coming out of it, and we are all glad that we're coming out of it. But there are two positive things that happened during the online platform we were forced to do during COVID. And one positive thing was that faculty in our university, at least, are very open to new ideas and new technologies. What happened was, since we were doing these Zooms and Google Meet classrooms, everybody had to rethink how they were teaching. And that's something that Mikhail also touched upon. But now I find that my faculty, whatever their age, whatever their years of experience, they were doing the same thing over and over again. But now they're much more open to new ideas, and they're very curious about what's happening in other places, whether it be technology or even things like methodology and the kind of theories that are going around about pedagogy and things like that. People have become much more open to that, which they weren't previously before COVID. That's one silver lining. And another thing that I noticed when we were doing online teaching, and that's more on at the ground level, is that whenever you do things like group work, there's always someone who is very shy and quiet in a group. There's always someone in the background who doesn't speak up that much. But when you're doing groups or online classes, like we're doing right now, when we talk to people online, everybody's flat. Everybody's on the same screen. They're just another name on a grid. So in a sense, it's easier to speak up. It's easier to identify and find out those students that are not speaking up. And in many cases, in an offline setting or a physical setting, some students might be able to get lost. And it's the job of us as instructors to find those students and make sure their voices are heard. But I found that in online, many of the shy kids were emboldened to speak up because they didn't have to face their peers, I guess. But yeah, so that was another good thing about the online teaching that I found during this pandemic.
Rabbani, thank you. That is a very, very important point that you mentioned. Several important points there, but one is just the student interaction level. As educators, and one time all of us were students as well, but you saw this around you, right? It's easy to teach the most motivated and highest performing students, right? They make educators' jobs easier. We show up, they do the homework, they interact, and that's it. But that's not, frankly, the challenge. That's not where most people are. As educators, our challenge is, in fact, to engage learners who otherwise could not be, right? Anyone can teach the highest motivated student, but how about the ones that aren't interacting? And I think Rabbani hit upon a very important point. The internet is the great equalizer in some ways. And just as it gives voice to people who don't have a voice otherwise in all sorts of ways, good and bad, by the way, right? Anonymous internet postings are also a thing, and we have to be cognizant of that. But in the same way, the psychology is the same. People who otherwise don't have a voice and who feel concerned about speaking up in public, we can actually do that in this online format. So thank you for addressing that. We had a question as well from an audience member, from Kritika, who mentioned that how do we tackle the issue of when presentations and discussions are not viewed as academic interactions, but viewed more as personal? How do how do students ask questions in a way that the presenter doesn't feel threatened? And I think that's an important skill as well. So let me actually go to that question and just ask, as educators, and maybe Salima, I'll bring you into this as well. As educators, how do you deal with creating an environment which is simultaneously respectful of the faculty, of the learners, because we're dealing with all adult learners here, simultaneously respectful and also encouraging debate, including healthy debate where you may push back a little bit? Any strategies for how you all as educators strike that balance? Salima, any experiences from your side to lead us off?
I think it's a difficult balance to strike because you have to sort of be mindful of ensuring that if it's a debate, it's going in a way that is productive as opposed to counterproductive and getting sort of tangential and irrelevant. I think one of the skills that we learned is we've developed a parking lot. It's just an easy way to sort of park discussions that may not be as relevant. So it helps students remember if there's something that they really do want to come back to. That's something that we utilize. We used to utilize it more in person, just write it down on the whiteboard, that these are the discussion topics that are parked. So if you want to come back to it later, we can, but for the moment, we need to get on with the class. I think other than that, we really do encourage our students to speak up as much as possible. And I think, as you were mentioning, and a lot of the others, Rabbani sir was mentioning, we actually face the opposite challenge of students are more hesitant to speak up. So I think when we have a discussion, when we have someone who's talking, even if it feels like maybe they're criticizing or tearing down a presenter, it's encouraged in a way that at least it's starting a conversation, and then maybe ensuring that we then divert it into a way that is more in line with what we're trying to say and ensure that the conversation, I think that's a sort of difficult, sort of like a moderator challenge. I guess that's what you're having to do now. And, it's something that really comes with practice, but I think beyond that, there's not much else you can do. Sometimes you will get students who might be a little difficult, but you just have to learn and manage.
It's absolutely true, and I'd love to hear other strategies from people as well. But Salima, reflecting on what you just said, I think we have in all cultures unique challenges, and I think in the South Asian cultural context, overgeneralizing a little bit, we have so many challenges in direct communication around cultural concepts of courtesy and of politeness, and the good aspects of respect, of mutual respect among all peers and colleagues, sometimes becomes based on age, based on gender, based on seniority, maybe based on other factors, ethnicity, maybe rural, urban aspects and differences. So at that point, I think, as a South Asian myself, I think, those cultural concepts of courtesy can become harmful, can impair communication when somebody who's more senior or more male or more whatever does not receive the same kind of feedback or pushback that somebody else might. Some of us have been in that situation and some of us have not. But I wonder if I could then ask maybe, Nazim, how are you doing in these small groups where you try to get people to interact and speak up with your students? Are there things that you do to increase that level of interaction, that they feel comfortable talking to the faculty?
Initially, I think that the most important thing for an instructor is the first class impression is very, very important for the course. So the thing we need to introduce such a way so that first class, they put barrier. They actually eliminate the barrier between the faculty members and students, and also their peers. So, and then the building trust, as I mentioned, relationship, those are actually few factors. But still, when I found the small group discussion, then maybe some of the students they're not talking. So I always try to find out what's the reason behind this, or maybe shyness or some other aspect. Then as I mentioned, I personally actually join each of the groups. So I always try to encourage and create a good environment so that everybody can actually talk. And sometimes I ask questions to find out whether they will talk or not. I just ask question and then what do you think about this concept? Then they start talking. So I think instructor needs to develop some sort of like instant ideas how to engage those students who are not actually feeling comfort to talk in class, even also ask question to faculty members. But in that context, I think AUW is still in a very good position. Actually, most of the students they talk. So it's hard actually to stop talking. So I found that's why I shifted from Canada and to AUW. So I left my job there and then I started because they're keen to learn, always keen to learn and always thinking creatively what to do and different initiatives, activities, club activities, and then also learning. So bothering always, like I always mention, please bother with me so that I keep my door open and then they come to my office and then we can discuss. So there are many different ways actually to eliminate those barriers, relationship building.
Thank you, Nazim, for that very much. Any other thoughts from the panel that they would like to share with each other? And then we'll certainly give our audience members, please, folks who are listening, you can type your question in the chat. Kritika, if we addressed your question, great. If we didn't, feel free to either raise your hand or jump in with your question if you would like. But we are open to other comments as well from either the panelists or the audience. Yeah, Mikhail, go ahead, please.
Yeah, just to maybe add to the point in response to Ms. Kritika's question, I think that it's so important that you raise this. This is a perennial challenge. What has worked for us is kind of what Nazim Bhai had also referred to, that from the beginning, we really do only have about a minute or two and that first day of the first, of the course to engage the students or convince students that this is a worthwhile course for them. And so there are obviously many, many creative ways in which to do that. But it's always been our kind of approach that how do you get, this is a very, unfortunately, a very conventional marketing approach, but it works in that how do you get students connected to your course right away? And of course, that requires something we don't talk about enough of, I think, in education, which is emotional deep learning. How do you engage emotionally with your students? Because that's actually one of the determining factors. And your emotional window is very narrow. But if we can hook them onto what we're trying to get them to learn in the course, you have them for life, so to speak. And so we place paramount importance on that first 5 minutes. It's kind of an elevator pitch situation where you really have to present your course in a way where students go, wow, this is it. I want to be in this course, because we've all been there as students. Within 2 minutes, we know that this is either a course we're going to love or it's a course we're about to check out of. So we put a lot of emphasis on designing around that human kind of instinctive response. And learning really needs to factor in the emotional dimension, because that's when learning takes place, when we emotionally connect. The other thing that we found that works is also trying to remove the faculty from the equation, so to speak, so that the faculty are not the ones kind of being the generators of the information or the content, but actually the students are the ones amongst themselves, through peer learning, arguing with each other and maybe not criticizing, but at least debating actively with each other about their respective points. And we know from data that peer learning is 70 to 80% of all learning. So really leveraging that reality of learning rather than putting the onus on ourselves as the faculty member, and being more of that learning facilitator rather than the source of learning, so to speak. And Dr. Omar, what you had mentioned, which is so important, that this formality that's in our culture, it's in most cultures, but I would say, at least in the South Asian context, this formality was actually part of the colonial engagement with education. This wasn't there pre-colonially. In fact, the what we call the guru-student learning, experience was incredibly informal And the guru would have the students eating out of their hands with the way that they would challenge them and give them ways to think provocatively about issues. They would be outside, so they would immediately take them to a real world situation and say, what do you think about this? And that would immediately get students really riled up intellectually and emotionally. And we, of course, departed from that very successful way of learning over the last 200 plus years. But that was actually part of what we tried to reinstill through our process. That same approach of a kind of, mentor, guru, student approach, where you really throw it to the students and challenge them to think about things rather than, just sitting there and talking too much. Immerse them in some kind of experience or some kind of moral, ethical question, and Socratically get them to kind of, debate about it. And you really facilitate them towards whatever your learning outcome for that session is. And that has really worked incredibly well. And of course, we're not reinventing the wheel. We've always had this tradition in our culture. Unfortunately, we substituted it. So we just need to kind of go back to what's worked, so to speak.
That is a really excellent point. I really appreciate that. And you make an excellent point about the Socratic method. I was going to mention that as well, that we have good precedent in all of this work, whether it's the guru-mentee relationship or the Socratic method of teaching, which again was leading the learner through a series of guided questions to the answer, as opposed to, unfortunately, how it's become a little changed in current pedagogy, which is really to put the learner on the spot by making life difficult for them. That's not the Socratic method. And in fact, the failure of the teacher to not take the learner through guided questioning to the right answer. So it's a fascinating pedagogical tool. And I agree with you. I think colonialism in all its forms has impacted the subcontinent particularly deeply. And I think we are living the legacy of that, certainly in teaching, certainly in formality, in the military rank system, in the ways in which colonial control was exerted upon people, and frankly, in patriarchal methods and structures as well. So I agree with you. I think having indigenous homegrown methods of changing things by going back to the source of what worked before, I think is absolutely the right way to go. I'd love to get some student or learner feedback on this concept. Again, I hate talking about people without having their voices, so I don't claim to speak for anybody except for myself. But if students or learners are here and they'd like to weigh in on what educational methodologies or pedagogies they would like to see from faculty, this is a safe space for you. I presume none of these folks are actually our faculty, so you can certainly talk about any things you have in mind or what method you would like to see, what would increase your engagement. You can put that in the chat box as we go on. Let's go to the next session. I think we're staying right on time. As people joke, we're staying right on time. Let's see what we can do to change that. But so far, so good. Let's go to our next presenter, and Dr. Ayaz Rabbani, who's the head of the Department of Environmental Science at the Independent University of Bangladesh, is going to speak about developing faculty capacities to facilitate professional skills development, which again is sort of the flip side of what we've been talking about so far. So Rabbani, we will turn it over to you, and thank you very much.
Thank you, Dr. Omar. Thank you, everybody, for still being here and listening to us speak. It's been a fascinating session so far. So what I'm going to do is I'm going to try to share my screen, and I apologize beforehand. My bandwidth is not that great, so I'm going to stop my video and share the screen. But let me see if I can do both, and then I will turn off my video. Okay, I think it seems to be working.
Yep, that is coming through good.
Okay, I've turned off my video so that there's less interruptions. Right, so we've had a very fascinating discussion so far on learning methodologies and all sorts of things. And I was also part of this program, this project that we were doing, the Transform PH project. And I was leading the Independent University Bangladesh's group. So this was a 3-year project where we actually looked at the different courses that we teach, and we basically systematically redesigned these courses. We took a year for each course, which is a long time to be talking and redesigning a course. But we found out that that was about the time we needed to redesign it. It was actually very beneficial for us, and I'll talk about that later on. But basically, there were 3 courses we decided to redesign, and a lot of people were involved in redesigning these courses. Here, the faculty that were involved. Now, we are a very small faculty. We had about 12 faculty, as it were, and 8 of us were involved in this project, and it was very helpful for us in doing this, and it actually made a lot of impact on our department as a whole and the way we teach and all of that. So let me just very quickly tell you what we did, and I'll keep the focus more centered around what effect it had on the instructors, on the 8 that were involved in the project. So this was the course that I was very much involved in. This is a course I teach. It was basically it's about air pollution and climate change. And this is really for senior undergraduate students. They're going to take this course and basically graduate out of the university. And they would go into fields of environment, development, and public health. That's where the jobs are. That's where they were going to use the skills that they learn at university to the job sector. Now, the thing about this course is it's a very old course. It was designed way back in the late 90s, and what has happened is that there were a lot of content in there. Different faculty have come in with their different skill sets, with their different background, and they've added to this course. The idea being that the more content, the better. And people have added all sorts of things. So the old content had elements of atmospheric science, air pollution, climate, environmental risks, and modeling, and all sorts of things. So the first thing we had to do when we sat down and decided to redesign this course, as I said, several faculty were involved with it, and the course was more focused on content. The idea was to jam pack as much content as possible, and this is very typical of many courses that we teach, especially in the South Asian universities. It's like, okay, you have X number of lectures. Let's see how much we can put into these X number of lectures, and see if we can put as much content as possible. And some of the topics that were taught in this course were not even relevant or relatable. Things like modeling. Now, none of the graduates from this course, the learners, they were not going to. Very few were actually going to go into very deep modeling or statistical modeling or things like that. They were much more, most of our students go into the job sector and they're working, where yes, some modeling knowledge helps, but they don't need to go into depth like in an academic sense, where they would become, academics working with numbers. So the course had details on air pollution and modeling, and I think there was a artifact of some faculty who was very interested in modeling and put it into the course, as it were. Now, adaptation is a bigger part of the conversation of climate change, and that was not included in the course as well. And it was very much based on the traditional mode of unidirectional teaching. You had a PowerPoint and you had presentations. You give a couple of readings for the students to do at home, and that was the traditional way of doing this. Okay, so what we did was we decided to reform the course, but we decided to put the emphasis on putting the learner's needs first. Now, we were not used to this. As faculty, we were not taught this way. Our experience was not the same. And we did realize that the way we were doing this, the traditional way, was not working that well, but we needed help. And I would like to give a shout out to the Institute of Development Studies at Maastricht University. They were basically the technical partners of this project, and they really helped us. And also our colleagues at Asian University for Women and BRAC University, I give a shout out to them as well. We all sat down and we decided to redesign this course so that we had a logical progression of the course. It wasn't like a hodgepodge of different things where we had a terminology, we analyzed the contents, and we suggest remedies. That was the decision we decided to take. And we decided to change the name from air pollution and climate change to climate change and society. to really emphasize that this course was supposed to be about looking at society and the impacts of climate change that will have on society. And that is what they will be using when they go off onto the field and work. They'll be working in societies and trying to interact with them and try to find out what the impact of climate change will be. And so it made more sense. The title made more sense. And the focus changed from helping the learners learn rather than what the teachers were able to teach. Now, whenever you walk into a course, there's an assumption that the teacher knows a lot about the subject, which is true. And the learners are there, the students are there to receive from the teacher. The teacher will give and the students will receive. And then we had to change that mentality and think about the fact that we're there to help learners learn, rather than looking at what the teacher is able to teach, what their background is, and what they want to teach. We have to let the learners learn for themselves, in a sense. So, as I said, learning that was a bit of a challenge. I won't go over the learning outcomes. We had to redesign the learning outcomes of this course to make it more in line with what the learners would benefit from, rather than what the teachers were trying to put into the course. We came up with this kind of a roadmap, as it were, a map of what the course is all about, and trying to link the objectives of the course, the learning objectives, with the specific skills that the learners needed or wanted to learn. And then also we decided to break it down into the 3 steps that we wanted to do. Now, the fun thing about this, while we were doing this, and I mentioned this at the beginning, that we did this so every course was redesigned for 1 whole year. And the fun thing was, I was teaching this course while we were redesigning it. So what happened was that I would actually ask the learners themselves, okay, so we're redesigning this course to make it more relevant to you guys. What do you want to see? What skills do you think you will need? And so that was a key part where I would bring it back to our technical people that we had from IDS and Maastricht. And then we would bring back the student voices. And it was a really collaborative way of looking at the course and looking at what the learners want to learn, and see if we can deliver, and we use our experience and try to structure it in that way. So it was a very illuminating way of doing things. Instead of 5 people sitting in a room and trying to figure out what is good for the students. So the challenges we had was, as facilitators, we don't call ourselves teachers now, as facilitators, we had to learn how to constructively align the learning objectives, the assessment methods, and our teaching techniques. We were not really tuned to this. We hadn't really done it this way. We were more thinking about, chapters. These are the topics that we will learn. This is chapter 1, topic 1, day 1. This is what they need to know. Chapter 2, topic 2. We were not thinking in the way that, okay, what is the learning objective of this course or the part of this course? How will we teach this? How will we assess that the learners have gotten it? Okay. Or maybe the learners themselves will assess. How will they learn? Have they learned what they're supposed to learn? Is there anything we can do to help the learners learn? This was an approach that we were not used to. And we had, I'll admit, there were times when we struggled on trying to find out, okay, I know this stuff. That's all right. Okay, I know this. But how do I get the learners to approach this so that they can achieve this learning objective? So that is why I said it took 1 whole year, but it was it does take a year. We also had to look at the assessments, the rubrics, give the teachers and learners an opportunity to learn from the assessments. Again, this was something very alien to us. We would take exams and then we would mark them, grade them, give the exams back, end of story. Okay, all right, let's move on to the next topic. But in this course, what we decided to do is okay, we will give back the exams, and then we will sit and talk with the learners as a group, sometimes individually, but mostly as a group, and find out where they struggled and typically we would find that the learners were struggling in the same places. So just the fact that as a group, the learners came together and saw that, oh, all of us are struggling with this topic. So maybe it is a little, it's a bit difficult thing to grasp. Let's work together and try to figure this out. Even that was a huge step, where the learners take ownership of what they were learning, rather than the instructor telling them that this is wrong, this is right, you get a 0, you get a 4, you get a full marks, you get a half marks. So we actually spend time talking about their assessments, their exams and class tests, and their assignments, sometimes as a group and sometimes in special cases individually. We had an opportunity to do mock sessions with our students, with the experts and ourselves. We did this all online during COVID, so we had the opportunity to do this. And there was a clear exchange, a very frank exchange of viewpoints in designing this curriculum. We also found out that the one-size-fits-all approach does not work. Different learners learn differently. And that is something we kind of forgot. We kind of go for the statistically most significant method. Okay, most learners learn by reading books, so let's do it for all of them. Let's give them a whole bunch of things to read. We are assuming that they like to read. But we found out that, especially again during the COVID time, when we had to do online teaching, we found out that, yeah, well, some students like to read. Yes, that's all very good. But some students also like to watch videos. Some students just like to sit and talk. Some students just like to hear. So we found out that different learners have different approaches to the way they learn and they understand. And that is something that we have to keep in our design of the courses. So some of the challenges we faced was that there were a whole bunch of different learning tools that we came across, both online learning tools and offline methods that we had to learn how to do. We learned the difference between deep and surface learning. Again, something that we as instructors often forget, that how to do deep or surface learning. To do deep learning, you have to give learners time to breathe, time to sit and think about a topic rather than bulldozing your way through topics. You have to give them time to breathe and assimilate what they have learned. And that is something we as instructors sometimes ignore and forget to give to the learners. We also, oops, sorry, I seem to have gone up to the last, okay. Yeah, sorry about that. And we also had to learn, understand the importance of student input, that the learners are a key part of the learning process. And we need to understand and appreciate their input. And get learners to stay and reflect on what they know about the subject rather than the facilitator being providing an explanation, which we call eliciting a response. And again, it is about the, rather than the facilitator giving an explanation of a topic or a concept, asking the learner what they understood and what they think is the explanation to a concept. And in many times it is, we've seen this when we were doing online classes and now we're doing in-person classes. 9 times out of 10, we see that in a classroom, one student or a learner is actually explaining to another learner a concept, and the facilitator or the instructor is actually taking a back seat. We're just standing there, pressed up against the wall, and we are taking a kind of a back seat, which is interesting. Again, something that we were not used to as a typical, instructor in a South Asian university. We're not used to doing this, but it's very enlightening to see learners learn from each other. And one thing I particularly had a problem with was silence. And I don't know if you can tell, but I'm one of those instructors that walks into a classroom and starts going off and talking continuously. I'm one of those that talks a lot in a classroom and in real life. So, and I thought that was a prerequisite of being an instructor or a lecturer at a university, that you should be able to talk out for hours and hours on end. And one thing that I had to learn to do is to shut up, is to let the learners speak amongst themselves, sometimes have just silence. So there would be a topic that someone comes up with, and they would say, oh, I don't know what would happen if this happens. And as a instructor, my initial response would be to give the answer very quickly, but I had to train myself to keep quiet. Even though I know the answer, even though I can help the student, I can tell them the answer, so I would have to learn to keep quiet and let the learners figure it out for themselves. Usually there's an awkward silence. Part of the cultural way we were brought up is we wait for the instructors to speak. But you know, after the first 2 or 3 times it happens during the semester, at the end of the semester, the students and the learners, they tune in. So someone would come up with a question that, oh, I wonder what happens if this is, I'm not exactly sure what happens. I had to learn to keep quiet. Silence was something that I had to learn, and let an awkward silence drag on for a few minutes. And then usually another learner or student will say, well, I think this is what it is. And then a dialogue starts happening between the learners. And then sometimes I would chip in just to guide them, not to tell them, just to guide them. And that is something that I had to learn how to do. And I think it was a similar experience for my other colleagues in my department as well. So let me show you an example of the things that we did where we changed the way we look at this course. This is a typical slide we had before we decided to change this course. Here is what are the factors that determine climate. And then we had a list of things that I, the instructor, have looked up the literature, looked up books and said, okay, these are the 5 things that we think are the factors that determine climate. So what we decided to do is decided to do it differently, okay? And then this was basically the old way of doing things. We asked them, we asked the learners, what are the factors that determine climate? So this was done online. So this was like sticky notes. Every student or most of the students, they would write their comments. And funny thing is, you would get the right answer. I mean, the old traditional answers like latitude and temperature and rainfall. But then you would get some very, very interesting answers from the learners themselves. The human influence, sunshine, nearness to water, greenhouse gas ratio. Now, this was not on the list. This is not something that I would have come up or the instructor could have come up on his own. These are comments from the learners. What this also does is that this starts to become a starting point of discussion. So instead of being a one way where I as an instructor tell them what the factors are that determine climate, the learners themselves, the students themselves, then start talking about the sticky note that they made. So vegetation. So you said vegetation was the factor that determined climate. Tell me more about it. And then the students would be much more engaged because they're trying to defend or maybe explain what they meant when they said vegetation. A much better way for students to get engaged and learn rather than for the instructor to tell the student what to do. Another example I will give you is this is a mind map of the Earth's energy balance. Now, some of you may have a background in the kind of hard sciences that I don't like the word hard science, but anyway, sciences that we usually talk about. And in any environmental science textbook, you can pick it up and you'll get a very good, beautiful diagram of an Earth's energy balance. But this one is the one made by the students themselves. So it was part of a group work. They got together and I just gave them the box in the middle, which is Earth's energy in and out. Go and figure it out. And they kind of discussed amongst themselves and they came up with this diagram. And you will find that, you will agree that this diagram, though messy, well, kind of messy, it is very close to what you would find in a textbook. It is very close to the topics that you would teach. But this came from the learners themselves. They sat down, they discussed in a group, and they came out with this. And there are some very, very interesting topics that come up, like entropy. Now, that is a very technical term, but this is something that a learner wanted to know. How was entropy related to the Earth's energy balance? Now, this is not something that I would typically, in the old traditional way of teaching, I would never put entropy in there. or the law of conservation. These are topics that the learners want to know. And then we would have a discussion and talk about all of those things. So again, a way to engage the learners into the learning process. We also, as I said, had an opportunity to trial this amongst our students, different kind of ways of learning. We tried them out. And one of the things we did is we asked them, okay, so how is this new learning methodology, how's it working out for you? We are ditching the traditional way of doing things and we're trying something new. How is this working out for you? And the answers we got is, again, from an online thing, the answers we got is, well, most of them found it very interesting. But then, as you would expect from, undergraduate students or senior undergraduate students, some are very interesting. It's exciting, a bit scary. Some people thought it was good. Some people thought it was more like Skynet 2020. But anyway, kids will be kids. But it was interesting. But most students found it very interesting. So now that was a good indicator that what we were doing was piquing their interest. And once you get a learner engaged and interested in a topic, they have enough resources and skills for them to go ahead and learn more about them by themselves. Our learners facilitators are just to guide them and facilitate them. Some of the challenges we faced was when we started redesigning this course, we actually thought that, oh, we just need to make minor changes. And that's also something we do when we redesign courses. I mean, everybody in all our universities, in all the courses we have, there is sometimes mandated or sometimes voluntarily, we will redesign courses, right? Every 4 or 5 years, we'll redesign a course, make it more relevant, make it more current. And we always think that it's going to be easy. It's got to be, we take a minor changes here, take out a chapter here, put in a chapter there, and it's done. But we found out that, it was not that easy. It was a well-established course. Making changes that we needed to make took a long time. Took us a year, as I mentioned. But with the more well-defined objectives and the learner-centric approach, there was a lot that needed to change. And designing from a learner's perspective rather than the teacher's perspective is not something that we were used to. And it took a long time for us to understand what that meant. Even the language, I'm getting ahead myself here a little bit, even the language we used in the daily sessions, the daily classrooms that we would say, was more teacher-centric. We would say that, oh, okay, so this guy somewhere talked about this theory somewhere in some book, and that's very teacher-centric in a sense. But a more learner-centric approach would be like, okay, what do you think a solution for this problem would be? How do you think this would be? Well, there was this one guy who had this idea. Do you agree with that? Do you think it's a good idea? We don't have to say that this person that we were quoting from was an expert on something or the other, because that basically shuts up the learner's perspective, but you encourage the learner's perspective to things. And one thing we struggled with, and I mentioned several times that as facilitators, we struggled to come up, to design this course from a learner-centric approach. And also the learners themselves were not used to this. Remember, these are kids from South Asian traditional methodology teaching. They have learned their whole school life, it was one-way teaching. The teacher speaks, the students learn, or the students hear. In many schools, the students are forbidden to even speak. If you want to speak, you raise your hand. This is the kind of environment they're coming from. And then asking them to be engaged in a classroom is also a learning for them. One thing I do now, for almost every class I walk into the class and say, okay, the title of this course is X, Y, and Z. What do you want to learn? That's the first thing I do when I walk into a course. I ask the students, what do you want to learn about this? And it takes them aback. They are almost in panic mode. They've never had any teacher walk into a class and ask them, what do you want to know? What do you want to learn? Now that opens up a whole Pandora's box, because then start saying a lot of things which you might not have the expertise on. Yes, that's fine. But then what it does is that it changes the way the learners engage with the instructor. It changes the way the learner engages with the teaching process. They realize that they are the center of the learning process. They came to this course to learn something about whatever it is. So it's almost a culture shock for them as well. But that's something that we do as well. Of course, we had to do this during the pandemic situation, so we had to do it during the pandemic. It was also a lot of fun. It was a lot of work, but it was a lot of fun. And I just give I'll skip over this because this is basically suggestions for the project. I just want to give a shout out to all of those people who helped us during the whole year to redesign this course and make it more object-oriented and learner-specific. Okay, thank you very much, and I'll open for questions and discussions.
Very good. Thank you, Dr. Rabbani. That was a terrific presentation, and again pulls in several of the concepts that we've been talking about so far in terms of moving away from instructional design or instructor-centered design more towards learner-centeredness. So important, especially as I was mentioning earlier about how COVID is an opportunity for us to redesign our systems to in fact be better. So thank you so much for sharing that. We have a couple of questions as well. Let's jump first to our fellow panelists and see if they have anything to add here. Dr. Salima and Dr. Nazim and Mikhail, if you'd like to jump in with any questions or thoughts from your institutions, how you are doing the same through the other members of the collaborative at AUW and the James B. Grant School of Public Health. Mikhail, would you like to add something around the lines of learner-centered design?
Yeah, I think just looking at faculty development, and if you notice the progression of each session, that was actually the way that we worked. Our whole design process, the learning design process, where the faculty were actually learners. We tend to forget that as well. We tend to not look at faculty as learners themselves, and we kind of treat them differently. And unfortunately, that's where we lose that learning opportunity for our faculty. So I think we started with the premise that, wait, faculty are not just faculty. In this instance, they are also learners. So we need to invoke our universal principles of learning to them as well. And so what we realized off the bat, and I think Rabbani Bhai has always just brilliantly explained how this process was so transformational, was we realized that the best way for our faculty to teach students or facilitate to students is only when they have had the chance and space and time to really reflect deeply on what is the curriculum? What is it that we really want our students to learn? Why do we want them to learn it? How do we want them to learn it? And this was the first time where our faculty had a chance to be learners and have that learning space to think philosophically about what they were looking at in their course, and to really get that time to think about that strategically from a design standpoint. And that was it. I mean, that time and space kind of, worked itself out, where faculty just came in with such great creative ideas and collaboratively as well, where a lot of times, unfortunately, faculty are just handed or inherit a course and they teach it, but they don't really get a chance to brainstorm and really hear from each other and share. And again, there's that peer learning experience that works so well. We just instituted that with our teams, and it just worked wonders in terms of what we came out with. And so that was key, that we start not with this, I think the conventional approach is where we have a foreign consultant come in for a 3-day intensive workshop on faculty development. You get a nice certificate, you put that on your CV, but you really don't have much, it doesn't have much bearing on how well your student experience for learning is, or your own sense of, designing a better course for your students and your own professional development. And so we kind of did away with that, and we thought, well, if our faculty are learners, let's put them through that learning process first. What do we mean by curriculum design? What do we mean by methodology design? And once they got through that process, they knew about 90% of how they needed to facilitate that. So then we just put them through that mock session, which Rabbani Bhai described. and they were just practicing and being evaluated by peers on what works and what wouldn't work for a student. And they just honed their skills remarkably well from that. And in fact, our technical partners remarked that we don't even do this kind of intensive peer mock of our teaching. And so we lose a lot of that chance to hear from our peers on what's working well or not working well. And so that was a huge breakthrough for us that I think made all the difference. And the last thing is that we also made a very conscious decision that we weren't just going to have foreign consultants come in and tell us what to do or hand it over to us. So we said, no, we are the learners, so we have to learn by doing ourselves. And actually the onus of this design and creative design process was on our teams and our technical partners and ourselves. We came in later just to help review what our teams worked on and to just kind of give a technical kind of objective view on this works well, maybe think about this. But the real work came from us and it didn't come from the consultants. And so that was a fundamental departure from what had happened in the past and what really didn't serve our needs well at all. And I think that was groundbreaking for all of us. And so that was where we took all of this together. And well, Rabbani Bhai's work speaks for itself. Nazim Bhai's work, I think, speaks for itself. That's what made all the difference for us and the real impact with students.
Thank you, Mikhail. That makes a lot of sense. And thank you, Dr. Nazim. Go ahead.
Thank you so much. Yeah, I completely agree on the instructor, also a learner. So this is very important. So what is important, like the first class, although we have a syllabus, we developed everything, contents, but what I do in my class, the first class, I put some small piece of paper, and then each and everyone, they should write at least one expectation. So what is your expectation in terms of contents or in terms of grading, whatever? They can write anything. And then I try to review it. Then I don't promise to change extensively the entire syllabus, but at least if I see something new from the content based, then I try to integrate when actually semester goes on. So this way, and then there are some interesting comments or opinions from their side, so that I can keep those in my mind and then during the entire semester. So this way, I'm also learner, and then I can also this system also help them actually to feel this is my course. My professor actually asked to write something in terms of expectation. That means they actually feel the whole ownership of the course. And then they start actually, this can facilitate learning. They can actually more curious to learn because they have written something and they're quite curious how they will learn. Yeah, thank you.
Very good. Thank you, Dr. Nazim, for that as well. And just for our audience, what we'll do is we have a final session, which is really an extended panel, which is going to be talking about this whole concept of the Public Health Learning Innovation Lab. So we will sort of segue to that, organically as part of this conversation. But we want to make sure we address any audience questions as well. Kritika, I know you had a question, and you're welcome to ask it directly, or I can interpret it from the chat. But if you'd like to ask it, please go ahead and unmute yourself if you'd like. In case Kritika is having trouble, her question really was around advice for learners in a more traditional learning environment. And again, this is part of the series of questions around how do learners function in terms of the issues we were talking about earlier, the hierarchy, where the balance of courtesy and interaction may become a little skewed. So any advice for learners and faculty, really, I think, maybe Rabbani, I'll start with yourself. How adaptable are the lessons that you spoke about in terms of faculty development to an online environment versus an on-site or a hybrid environment? If you would comment on that, please.
Right. Thank you for the question. I just want to emphasize that it was not easy. as Dr. Omar Khan said, the cultural background that we have, it is not easy for the learner to come out of their traditional way of learning or the teaching environment that they're so much used to. And it is something that needs to be practiced in the classroom. Maybe it might not even be in one course where the learners will be comfortable talking about making use of the learner-centric approach that we are trying to do here. You know, as the online teaching methodology taught us, that sometimes it actually helps to have an online teaching component to a course, and of course it helps to have a physical component. So the Dr. Omar Khan, he talked about the hybrid, and that is something that our department is looking at very seriously. And again, our department is environmental science, and we are very much into hands-on practical learning. But then we are also looking at, oh, okay, maybe the students would be more engaged if there was an online component to it. Maybe they would be more engaged if we were more present in social media. Maybe the social media, use of the social media is a way of getting the learners more interested in the courses. Again, this is something that came out of the Transform project that we did, and also the situation we faced ourselves in. And it's about trying out new ideas and being brave enough to try new ideas. And it goes for the instructors or the facilitators and the learners as well. The learners also have to be brave, and the instructors also have to be brave to try different things and see which one works. Yeah, and I repeat, it's not easy. It's not easy. It needs a lot of work from the instructor side, a lot of hours of work, and also from the learner side, there's a lot of things they have to do as well.
I think that's an excellent point. And as we now transition more towards our panel discussion on the Public Health Learning Innovation Lab concept, building faculty learning ecosystems, Salima, let me bring you into the conversation here and consider what have you seen as potential facilitators and barriers to faculty being able to connect in this way across institutions? Now, we discussed a model of a wonderful collaborative here that you all have set up, but that didn't just happen organically. Even that was difficult. As Rabbani said, you know, doing this work is tough. How do you build such models of collaboration, of cooperation across faculty who, frankly, you know, there's a very hierarchical model to doing things, right? You become an instructor, assistant professor, eventually tenured professor. And frankly, we're not used to, in academics, working in those kind of teams that we encourage our learners to do that. Tenured professors typically don't talk to other tenured professors to say, hey, listen, can you watch me teach? Can you watch me do this? And then critique me and tell me what you think. But anybody who designs things for a living knows that that's how you improve. So even as an experienced presenter or an experienced physician, it's wonderful to get feedback from other people. But I also recognize the more you go up that ladder, the less we take advantage of that. So that might be something interesting to discuss. But Salima, any thoughts from your perspective or BRAC's on barriers and facilitators to faculty collaborative like this?
Thank you. So that's a pretty serious question to jump in on. I think it's important first to leverage existing relationships within institutions. So for our project, for example, we didn't just go in and approach completely new universities we hadn't worked with. We approached universities who we have existing research relationships, collaborative relationships with, we've worked with in the past. There needs to be a bit of a mindset within that institution of being interested in change. So we were really lucky that the institutions that we initially partnered with have administrative heads and departmental heads who are open to innovation and learning. So it was quick and easy. For example, for this particular project, we approached IUB, and it's more, it's slightly separate research wing, ICCCAD, and that's that institute's head, Dr. Salim Ul-Haq. He was very, very much interested in invested in ensuring that we develop faculty skills. We reform the curriculum. Similarly, at AUW, there was there was a yearning for learning and change. And once we started working with faculty and teams who we knew would be interested, it sort of snowballed from there. So sort of inspired by CUGH, we have our own sort of local national public health consortium where we have public health schools from across Bangladesh who come together and sometimes do some peer sharing and learning. And so what we did was around the end of the project, we started sharing our learnings there. And that sparked an interest in often younger faculty, you're right, as people go up the ranks, maybe they're less available, less interested in taking up this sort of challenge. But younger faculty who are just learning, who have recently graduated and remember their struggles as a student, who remember what they want to see changed within the educational system, are very receptive and excited. I know personally for me, I'm not as senior. I'm involved as a facilitator, not even like an official faculty. So I was very excited from the get-go to get involved in this project because I knew what I wanted to see changing in the educational system. I know what didn't work for me, what was difficult for me to learn. From a personal example, when I was studying, our teaching method was very didactic. Our facilitator is very unidirectional, reading off of slides, very dull teaching. And there was this one particular faculty who started introducing little handouts, she did videos, she gave us little exercises to do, she forced us to solve them. Class would not continue until everyone had submitted. So it was really ensuring and engaging everyone. And I learned more in that particular course than in any other course just because I was constantly engaged. And so when we started doing this work, I was immediately drawn into the engaging faculty and I think engaging students in the active learning process. And I think that's what we've seen amongst other faculty as well. As soon as we say there's student engagement, everyone's eyes sort of spark up because student engagement can be so tricky. As soon as you hear that, oh, this is a way in which students are participating and feeding back and responding to what you're teaching as opposed to sort of speaking to a silent classroom, I think people start sort of tuning in and thinking, okay, maybe there is something I can take away from this. And it starts that conversation that can then further into stronger collaborations.
Thank you, Salima. That's very helpful. And thank you for sharing that experience. And I wanted to mention that I really like the idea of the local public health collaborative that you guys have built. And remember that as CUGH members, the BRAC JPGSPH Grant School of Public Health can actually request to do sessions on occasion through CUGH's platform as well. So if you would like to have a session on anything in particular, a webinar, you can always contact CUGH and say, we'd like to do a webinar on this topic of general interest to CUGH. And typically they're about 50 minutes long and they can be done throughout the year. So keep that in mind. Thank you for that. Mikhail, I wonder if I could ask you to frame a little bit as the learning design expert around the concept of faculty learning ecosystems. This has been set up now. We've heard a great set of case studies and outcomes as to how this is going. But I guess two related questions. One, how do you sustain these across the country and how do you scale them up to other institutions? And B, how do you measure the outcomes of faculty collaboratives? How do you demonstrate outcomes to administrators, university presidents, those who wonder, why am I investing funds into getting my faculty together with other competitive universities, faculties? How is this benefiting us? Any thoughts on that?
So I'll start with your first question about how do you make this sustainable. So I think the idea is that when you have something that faculty feel that sense of ownership and champion themselves, it's quite infectious. They champion it because they see the results. They see not only the difference in their students, but faculty also go through that change where their engagement with the classroom and students fundamentally shifts. And I've always been a kind of a firm believer that faculty are there's an undue onus placed on faculty to teach in this way, because it will yield such difficult kind of, classroom kind of experiences, because it's just so stressful even for a faculty member to on her own have to talk for 3 hours. I mean, and just keep kind of disseminating information. It's quite dispiriting also for faculty. And I think we were very cognizant of that, even though that's not spoken of enough of. I think there's an emotional element that faculty also feel very demoralized by the way in which, they have this classroom experience. And so when they see the shift where students are suddenly coming alive, they're engaged with the material in a different way. And the faculty themselves start finding a different level of fulfillment from that. That changes everything, and they take that with them. And we've seen that in our own school, where they want to now spread that way of doing it with other classes, and we see that more and more faculty are more receptive to that. And so it's not something that will happen overnight, but we certainly see that sense of there is a bit of a ripple effect where other faculty are much more intrigued by this, because they see the difference with students. And in fact, we've had cases where students start making demands on other professors, say, hey, are you going to do the same thing you did in that anthro course, in that intro course? And that also becomes a bit of an organic kind of push to rethink how this course will be taught differently. And so that's kind of our strategy, that we do it step by step. We also work with other faculty that we know are like-minded about it. So we're not going to just convince everyone overnight. We're really going to be strategic about, well, I know this person is going to be interested, let me bring her in. There's obviously these informal networks within our institutions that would be keen to do this. So we're very selective which way we go, and organic about that approach. Other than that, I think the student experience takes, the difference in the student experience and outcomes goes a long way for faculty to kind of go, wait, we need to rethink this, because something's going on here that's quite powerful. And so everybody realizes that this is not just the usual, 5-day workshop. This is something that's much more kind of visceral, so to speak. And so that also kind of piques everyone's curiosity. I don't know if that answers your question.
No, it does. Thank you. No, I think these are such foundational concepts that I'm struck how have we done away with hierarchy in certain fields, or at least improved it. And one of the examples from my field, is research. When we do research, particularly basic science or clinical research, we have a more horizontal way of doing things. Now, of course, there's a hierarchy in research too, but because the views of our postdocs and our PhD students and our master's students, everybody who's deeply engaged is going to improve the research, and they might catch things that the more senior members don't. We listen to everybody. Everybody's voice is equal, and frankly, ideally, the person who contributes the most gets their name on the paper first. They could be a graduate student, and frequently are. And teaching has yet, I think, to achieve that level of horizontalness. I think the academic hierarchy of teaching, and again, you see it reflected in our titles, as we talked about earlier, the colonial mentality of titles. We don't have the guru-mentee thing. We have assistant guru, associate guru, tenure track guru, and research, all those things, right? So that leads to a hierarchy. And I think criticizing a senior professor, I still come across this when visiting Dhaka. If it's a senior professor of medicine, he, unfortunately, most times he shall not be criticized, right? And their diagnosis. And so we have to break out of this hierarchy in fields of learning. When we learn the most sometimes from those who are the most junior, they may not have the most developed or mature ideas, but they may have the best ideas and may have the newest ideas. And folks like us, I think, all need to listen a lot more. So one idea that I wanted to throw out there was about regional collaboration. You all have shown us an amazing model of regional collaboration here, and I'd love to get some conversation going, and CUGH can be helpful in this. How do we regionalize this approach to across, say, even South Asia, to India, to Pakistan, to Nepal, to Sri Lanka, and get our colleagues who are faculty who are teaching public health. Public health is public health at the foundational level, and then we have local individualities that, of course, are context specific. But a lot of public health is common across South Asia, and having some common lessons learned We started a collaborative many years ago called the South Asia Infectious Disease Network, which I headed up more than 20 years ago. We found out among the things that united South Asians in general, if people may want to take a guess what those 3 or 4 things might be. Of course, the most important, cricket. Second most important, food. And then, of course, family. But joking aside, a lot of it was science. We were all brought together regardless of other potential barriers by science, by learning, by teaching, by research. And we set up wonderful collaboratives. We couldn't travel to each other's countries always, but we had these amazing experiences. And Bangladesh had been a host back then as well, because everyone could travel to Bangladesh. So I'm just wondering if the experts in this group, you guys can, as a panel, can talk about approaches to regionalizing your collaborative, or if that's even an aim that you'd like to start something broader, and maybe others on the call can jump in and say how they might like to help also. I'll start with anywhere in particular, anyone can jump in. I'll speak from the perspective. Yeah, Mikhail, go ahead.
Sure. So I think the idea is that right now we're at a moment, kind of a point of inflection where how do we expand this, roll this out in our respective institutions? How do we get that buy-in to expand it? And then, of course, from there, hopefully we reach critical mass where other schools now, we've actually got 2 other schools who've expressed interest to start thinking about this approach. So I would say from a regional perspective, it's 1 school at a time. So that intensive one-to-one work in early days, like with the Nepali School of Public Health, that relationship building with them, that can trigger them to then spread it more in Nepal and finding us ways to work with other schools. So I would say it's always a one-to-one, in the startup days, so to speak. So it's very intensive core team of champions who are really trying to work closely to see whether this impact can be replicated elsewhere. And that requires a lot of experimentation in any new institution. We took a few years just amongst ourselves to get this model right for us. So of course we would need that latitude with, if we went to India in a particular school or Nepal, we'd still need that 1 to 2 years of, experimentation, what's happening in Nepal, and how would we customize this for them? Because each time it has to be tailored. There is no kind of, ready-made formula for this. That's why I think it worked for all of us.
Yeah. Very good, thank you. And Dr. Nazim, please go ahead.
Thank you so much. So in that case, actually, AUW is, we are in an appropriate position actually to expand, because our students coming from 20 different countries, we can have, because we already have this collaborations with the students coming from different countries, but at the same time, because we also have a different kind of partners, like who are actually selecting those students for us. So there are already existing networks we have in each country. This can be the entry point for us actually. So as soon as we expand within our country, at the same time, we can actually, when our students bring back and they start working within university or maybe public health organizations or UN agency, there are different ways actually we can connect them, like alumni, we can connect them, and then somehow we can enter. It's sort of like snowballing, as Selima was also talking about that. We can snowball, and then somehow there is a connectivity, and then we can start from there, at least from 1 or 2 or 5 countries initially, and then we can have a small network at the beginning, and step by step. It will take time, of course. We cannot change overnight everything, but it took 1 year to have this kind of change within project, but 3 years, of course, for this project. But maybe somehow we can have a 5 years plan, and then step by step we can approach those kind of networks.
Thank you, Dr. Nazim. I think that's a very sound idea. And we can, as I mentioned, from the CUGH perspective of any of the organizations, we could host, because we can do things on the web now, we can host a web-based conference or a mini consultation where you can invite folks from counterpart institutions to present where they are, to present where you all are, and to see what aspects of that collaborative might be interesting for them to participate in. And again, what would be specific to their needs, and one can thoughtfully, proceed along those lines. And I do think, going back to a wider point, if we are to break out of a post-colonial era of where things have been done and said that we are still living the legacy of, we have to come up with indigenous, homegrown methods of doing the right thing. But I also think South Asians in South Asia have a lot to teach the rest of the world as well. And I would love to see more regionalization and internationalization of the learnings coming out of the region. I think we have a question here from Navneet, who
I
is
just wanted to
both.
jump in
Yeah, go
before
ahead.
we move on
Yeah,
to
Salima, go ahead.
So one of the things we're doing in the schools, we've been applying the learning in some of the partnerships that we already have existing. So similar to CUGH, we are also part of the Open Society University Network, who have invited us to do some shared modules with them, and we've been applying some of that learning there. So because you've been talking about ways in which maybe CUGH could collaborate with us, I think one of the things we are trying to do at JPG, I know specifically, I can't speak for everybody here, but I'm sure it's similar. Now that joint learning, student exchange is one of the ways in which we're sort of promoting collaborations between universities. And I know CUGH has its own set of courses. Maybe if there's any opportunities there to design specific courses that fit in, maybe we can work on collaborations there. Because I think what Mikhail was saying is adapting a whole curriculum for a particular institution takes a long time and is a lot of work. But at the same time, there are ways in which we can perhaps collaborate together and bring together some of our learning with an international partner and figure out ways in which we can help each other out.
Thank you, Salima. I really like that idea. And if you can, perhaps if all of you would like to send me examples of short courses which other folks can take, especially online. For example, that anthropology course that you mentioned sounds very interesting. If folks from abroad can participate, ideally if it's online, send those to me and we can see what we can do about getting those up on the CUGH website as well. So please, everyone's welcome to do that. Navneet, who is simultaneously from India and California, go ahead. You're on mute. If you are welcome to unmute and ask your question if you'd like.
Yes, thank you. So yeah, I didn't realize that. Thank you for an excellent discussion. And I'm so proud of your efforts, everyone, trying to dismantle the top-down approach, the South Asian way. But so we just a question about, you talked about collaboration. Now, yes, I understand we are talking, and this is my pet peeve with the CUGH way back to when it first started. Initially, I've been consortium, forget the name of the original name, it's slipping my mind. You mentioned it, Omar, earlier.
GHEC, the Global Health Education Consortium.
GHEC, thank you, yes. So I've been sort of almost from the beginning involved in an indirect sort of way with GHEC and then CUGH, and I love what you have, what you're tabling as far as collaboration of universities across the world, ideally. The fact that we have only 20 people in a South Asia discussion on curriculum is a bit disappointing, but it'll get better if you all collaborate. And that's especially why I like this question that Omar brought up. So I am not involved with any university currently, but I do have a climate action NGO in India. And I was private messaging Nazim about collaborating in research opportunities so is that an option CUGH is open to? I mean, collaborating with NGOs and advising them, because we are on the ground. I mean, we are doing serious activism on the ground. And I'm talking about my NGOs in India, in Punjab. And so, yeah, is that something that is a possibility?
Sure.
I mean, of course, I'll be in touch with Azim. I've already emailed him, but yeah, please go ahead.
That's a great question, Navneet, and thank you. I think a lot of the work that you're mentioning, the distinction between applied work and educational work sometimes is academic and sometimes one grows out of the other. BRAC was the world's largest NGO long before it engaged in a formal educational program as the James P. Grant School of Public Health. So applied research and education, I think, go hand in hand. So thank you for all the work that you're doing on climate change. As you've heard from all of our colleagues, obviously a huge issue, especially for a low-lying country like Bangladesh, but really across South Asia. So the short answer, I think, is yes. I don't speak for CUGH, but we can speak with Keith Martin and our colleagues, and there are climate action working groups, and we can talk about how to more intentionally link with your work and how to more intentionally perhaps set up a collaborative, if you'd like, So email me or PM me with your contact information, and we can go from there. We also have several colleagues who run global health collaboratives and institutes. You can talk with some of our folks at the APHA, American Public Health Association section of International Health. And as a former chair of that section, I know we have an active climate change group as well. My friend Neil Arya runs the Pegasus Institute, based out of Canada, but operating worldwide. You may want to check out some of their work as well. So I think giving a home to the kind of collaborative you're mentioning, if that's what you were thinking about, I think several opportunities to do that, but let's be in touch and figure out ways to do that. So thank you for the question.
Great, thank you.
So we're right at our time, but I'd like to give the opportunity for a quick closing comments from anybody who would like. And Rabani, let me just start with you in reverse order and see, would you any closing thoughts from your perspective?
Thank you. No, this is a fascinating discussion. And as Mikhail was saying, we are learning, we are learners, and I'm really glad that I was part of this discussion today. And yeah, I'm going to keep it short and sweet here. Thank you.
Thank you, Rabani. It's been a few years that I visited IUB at your Baidadhara campus. I hope to visit next time I'm in Dhaka. Dr. Nazim, any closing thoughts from you?
Thank you so much. I'm really pleased to be here. So my point is, like, it takes time. It's changing behavior and attitude, and particularly changing something from a traditional way and then completely different approach. It takes time. We have to be patient. So we're applying for this so that we can also follow that path. It will take time, long way to go. Thank you so much.
Great. Thank you, Dr. Nazim. Salima, how about you? Any closing thoughts from your comments?
I think we're losing our audience, so thank you. I just want to thank you personally for really pushing us to do this satellite session. Has been absolutely lovely. I think getting to engage with so many people and being able to discuss openly with global institutes across who are working in public health has been really lovely. So thank you again, and thank you, CUGH.
Of course. Thank you, Salima. I should mention also that as the satellite session is being recorded, what we've seen the last couple of years of CUGH, that many folks actually access the recording. I already got a note, it's Friday's a work day in North America, so not a lot of people will access it right at that time. Lots of people will look at the recording later on, and because satellites are free to access, they remain part of our materials for quite some time. So it's a wonderful session again. Thank you as well. And the last word, Mikhail, goes to you, my friend who always looks young, always has amazing thoughts to share, the expert in learning design, not instructional design. So any closing thoughts from you?
Thanks. No, I mean, we really appreciate having this chance to share this and learn from each other. I think just to wrap up, nowadays everybody is talking about decolonizing public health. And I think we do have to be careful that we don't just stop at that, because decolonizing public health doesn't get us to where we need to go. I think we need to get to indigenizing public health, going back to who we were in terms of our own health identities pre-colonially, so to speak. But also it's important that we not just look at indigenous public health, but also indigenous education. And those have to be combined if we want real transformative public health education to work and to have real impact. And that does mean that we need to kind of return to find out what our own kind of South Asian metaphysics, philosophy, education really constituted. And I'll just finish with what Tagore said when the British left. He said, "What good is political independence without spiritual liberation?" And so we need to remember that with public health, we also have to invoke that principle moving forward.
Thank you, Mikhail. And thank you for ending on such a wonderful point from one of my favorite poets. I think still one of the very, very few Nobel Prize winners for literature from the subcontinent, unfortunately, but an amazing poet. And thank you for closing with that inspirational point. I want to thank all of you for taking the time out of your day to be with us and to discuss this important topic. This will be part of the recorded session at CUGH, and we hope that you enjoy the rest of the conference and the other satellite sessions. And thank you to everyone, and we will see you hopefully very, very soon. Thank you, and good afternoon, good evening, and good morning. Take care.